1 p.m, so
Thanks very much.
get proceedings underway. And I welcome everybody to the supplementary public hearing for the inquiry into budget estimates 2022-2023, specifically with respect to portfolio number 2, health. I acknowledge the Gadigal people of the Eora Nation, traditional custodians on the lands on which we are meeting today. I pay my respects to elders past and present and celebrate the diversity of Aboriginal peoples and their ongoing cultures and connections to the lands and waters of New South Wales. I also acknowledge and pay my respects to any Aboriginal and Torres Strait Islanders who may be joining us today, who may be coming into the room, or welcome to you if you're joining us on the internet. I welcome Minister Hazzard and accompanying officials to the hearing today. Today the committee will examine the proposed expenditure for the portfolio of health, as I've previously mentioned. Before we commence, I would like to make some brief comments about the procedures. Thanks. For today's hearing. Today's hearing is being broadcast live via the Parliament's website. The proceedings are also being recorded and a transcript will be placed on the committee's website once it becomes available. In accordance with the broadcasting guidelines, the House has authorised the filming, broadcasting and photography of committee proceedings by representatives of the media organisations from any position in the room and by any member of the public from any position in the audience. Any person filming or photographing proceedings must take responsibility for the proper use of the material. This is detailed in the broadcasting resolution, a copy of which is available from the Secretariat. All witnesses in budget estimates have a right to procedural fairness, according to the procedural fairness resolution adopted by the House in 2018. There may be some questions that a witness could only answer if they had more time or with certain documents to hand. In these circumstances, witnesses are advised that they can take a question on notice and provide answers within 21 days. If witnesses wish to hand up documents, they should do so through the committee staff. And finally, Minister, I remind you and others officers accompanying you that you are, of course, free to pass notes and refer directly to your advisors seated beside you or behind you. Finally, could everyone please turn their mobile phones to silent for the duration of the hearing. All witnesses are sworn prior to giving evidence. Ms Hazzard, I remind you that you do not need to be sworn, as you've already sworn an oath to your office as a Member of Parliament. I also would like to remind a number of the witnesses here today that you do not need to be sworn, as you have been sworn at the previous budget 2022-2023 budget estimates hearing before the committee. That being said, it means we effectively only have to swear in 2 witnesses today. Dr. Chant, welcome, and Ms Wilcox, is that correct? Ms Wilcox, thank you very much, both of you, for being available today. So we'll perhaps start with Ms Wilcox, move left to right, it's probably easier. So if you'd be good enough to state your name, position, title, and then the agency you're from, and then swear either an oath or an affirmation, whichever you prefer, the words of which should be provided to you. If for some reason it's not, please just raise your hand. So we'll start with Ms Wilcox.
Thank you, Chair. Deborah Wilcox, Deputy Secretary, Health Systems Strategy and Planning, New South Wales Health. And I'll take an affirmation, Chair. I solemnly, sincerely and truly declare and affirm that the evidence now about to be given by me shall be the truth, the whole truth and nothing but the truth. And Chair, just for the transcript, there are 2 L's in my name, just so that's accurate.
Thank you very much. So Hansard will pick that up. So
thank you.
That's important to note. Dr. Chan.
Dr. Kerry Chant, Chief Health Officer and Deputy Secretary, Population and Public Health, New South Wales Health. I solemnly, sincerely and truly declare and affirm that the evidence now about to be given by me shall be the truth, the whole truth and nothing but the truth.
Thanks very much, Dr. Chant. So we'll get proceedings underway today. As you would be all aware, the time allocation for the totality of time today runs from 1 o'clock through to 4:30 p.m. if all that time is required. We're going to have a 15-minute break at 2:45 p.m. to let people have a stretch of legs, etc. Now, what we normally do, and it's been agreed that we would follow our normal practice, is that we'll move in 20-minute tranches between the opposition and crossbench, back and forth, with the reservation of 15 minutes at the end for government members to ask whatever questions they think they may need to ask. It's a reserved position. If they don't wish to ask anything, so be it, but that's a firm reservation of 15 minutes at the end for government members if they wish to avail themselves to it. So thank you all once again for your attendance today, and we'll commence our questioning from the opposition.
Mr. Chair, just before you do that, can I just clarify? So if the government don't have the 15 minutes, we would finish what, at 4:15, or how does it work? 4:15. The reason I ask is that after we organised this, after we all agreed this was a good time to have a hearing, Minister Butler, Mark Butler, has organised a National Health Ministers meeting starting precisely at 4:30. So I've got to get back and just prepare for that.
Okay, well, certainly we'll be cognizant of that, Minister.
Okay, thanks very much.
We'll be sort of, sorry, 4:30 that was? Yep. Okay.
Yeah, well, it starts at 4:30. So
Where will you be able to participate in that from?
I've got to go back to my office for the screen.
Yeah, that's in this building or another building?
No, it's in the 52 Martin Place.
Okay, fine.
It's only.
Okay, no, that's fine. That's all right. No, we'll work towards that, so we'll certainly be finished by that time. Thank you for that, Minister. That clarifies things. So we'll commence with our questioning. The opposition, the Honourable Courtney Hussos.
Thanks very much, Mr. Chair. Thank you very much. Good afternoon, everyone. We appreciate you being here. Minister, perhaps for the last time.
Yes.
I think so, Courtney. Yeah.
Mm-hmm.
I can't say that I'm sad about that at this point. But I will miss you all. I will miss you all. I genuinely
We'll miss you
all.
too. Minister, I wasn't here for the last estimates hearings, but I understand that you said during those hearings the concept of what still causes major grief in other states, that is ambulance block, is actually very rare now in New South Wales. Do you still stand by those words?
Yeah, I do, and I think that it would be better if the Secretary were able to answer why rather than me, because whatever I say you'll think is political, so I'll hand over to the Secretary and she can explain the details. Madam Secretary.
Thanks, Minister. We touched on this issue at the ED inquiry a couple of weeks ago. My recollection, and obviously the Minister can speak for himself in regard to the words that he used, was with the gravity of the issues that we experience here as compared to other states, rather than suggesting that we don't have issues with ambulance delays at times, because we've openly commented about that on a number of occasions, that we do have really difficult days. But when compared to other states, as per our submission to that inquiry, we do perform better.
Okay, but you would be aware of the testimony at the inquiry, for example, from Dr. Claire Skinner, a doctor in northern Sydney, and she said, when I was a junior doctor, we had it maybe a couple of times a month where the hospital went on to what's called bypass when we're unable to provide timely care and offload ambulances. During my career, it's now become a regular occurrence to the point where it's actually now normal, where every shift we have trouble offloading ambulances and seeing people in beds. That's a doctor on the front lines who's providing
I'm very
that
familiar
feedback.
with what Claire had to say, and it's okay that, Claire can have her views, and I think when she was younger there were far less staff and far less people coming into the emergency departments, and every health system is working under pressure right across the world. We've just come out of COVID, and I think it's understandable that doctors would be principally, or some doctors would be principally concentrating on that. Having recently spoken to one emergency specialist in exactly the same position as Claire, he said at his hospital the doctors come out when there's an ambulance coming and they effectively do a little triage themselves to determine whether or not the ambulance has to stay there for a little while or not. And so there are different ways of doing things. That's the first thing I do. Secondly, I'd say that when I've met with all of the other Labor and one Liberal minister now around the country, they all acknowledge that New South Wales is the most outstanding and leading in regard to the issue that you're raising. And in fact, you may or may not have noticed that in the new government in South Australia, and I'm not for one second saying anything negative about Chris Picton, because Chris and I get on extremely well, but Their challenge is now that their offloads are around about 46, 47% within the due time, whereas ours are up high 80s and 90s across the board. So, you know, you can always, in a system as big as New South Wales, pretend that it's a disaster. No, it's not. It is absolutely not. It's actually doing extraordinarily well. You will find doctors and nurses from time to time who've actually experienced bad things happening to them in the sense of pressures on a night, pressures on a day. There was pressures a couple of days ago at, I think, Blacktown Hospital. These things do happen, but it doesn't indicate an overall systemic failure. New South Wales leads the nation by a long shot. And every other, if you want to make a phone call to any of your other Labor ministers around the country, they'll all tell you that. In fact, most of them have been up here to talk to me about how we do it. And in fact, as recently as 2 weeks ago, we had two of them up here, meeting with the Secretary, meeting with me to talk about precisely those issues, to look at how well we do it.
Okay, but
Having
Minister,
said that, go for it.
Minister, and I have the greatest of respect for Chris Picton. I've known him for more than 20 years. I understand they are facing different problems in South Australia. I'm asking you about New South Wales hospitals.
And I'm putting it in perspective.
I'm saying to you,
Courtney.
and
I'm not going
I
to put up with.
appreciate-
I'm not going to put up with
but
being beaten up by.
Order.
I allowed
Order,
you
Minister.
to finish. Let me
Order,
finish.
Order. So, Minister, your opening comments were you'd hand the answer to the question to the Secretary because you didn't want to get political. That's exactly what you've done with respect to...
No, I haven't. I've talked about substance.
Overtly political. Now, you know, you've been around long enough. We ask the questions, you answer, and it goes back and forth. And we don't talk over each other. So...
Thank you. Well, you asked the questions, but I can put them in perspective. I'm entitled to do that. And I've been here a long while too, so I know that. Sorry, Courtney.
Well,
Minister,
I'm glad you apologised because it was very rude to talk over the members. So, the Honourable Courtney Hussos.
Minister, I accept what you're saying, that there might be individual doctors or individual times, but this is the testimony from Dr. Skinner, who appeared before the parliamentary inquiry. She actually went on to say it's not a COVID phenomenon and that it's been growing for decades due to underinvestment, under-resourcing and poor coordination of community-based care.
I can respond to that.
Sure, Dr. Pearce.
If that's okay. Look, we submitted to the inquiry a written submission, and that submission details our performance over several years. And certainly in the lead up to the COVID pandemic, the system was experiencing more pressure due to emergency department volumes and increasing numbers of people coming to emergency departments. But I think our submission speaks for itself in terms of our overall performance, Ms. Hussos. The issue is that I've also been in the health system for a very long time. And I can remember some years ago, and I think Dr. Morgan may also be able to assist with this as the Chief Executive of the Ambulance Service, where it was not unusual to have ED delays and ambulance delays of 7-8 hours. We have eradicated those lengthy delays from our system. We watch this very closely every single day. Does it mean that we are perfect? No, we are not. Does it mean that we don't have days where it's incredibly difficult? We've never suggested that for a moment. But what we do is work with our system to see how we can make it better. And just yesterday we had a round table involving a large number of staff, including Dr. Skinner, and others from across New South Wales Health, doctors, nurses, allied health professionals, along with the Agency for Clinical Innovation and the Ministry of Health, to work together on how we continue to improve our health system, because that's our job and we take that very seriously. It was a very collaborative discussion, solution focused. And our attitude is that if any state has got the capability of addressing the challenges that we face from a multifaceted perspective, it is New South Wales, because of our, otherwise very good performance.
Can I just jump in just on that, Secretary? Were there pharmacists involved in the roundtable yesterday?
Yes, there were.
And can you tell us what the pharmacist said?
Mr. Donnelly, the day went for about half a day yesterday. I was there for the start of it. The team are feeding back to me all of the outcomes from the day. And what they've worked to do is to come together with, as I said, a solutions focus. In fact, I met the pharmacy representative, or one of the pharmacy representatives that was there yesterday, and spoke to her about the opportunities that may exist in that space. But
Can I just ask
we-
what opportunities you raised with the representative? from
Well,
the-
I look, there are some very basic and obvious things in regard to hospital flow, because we talk a lot about emergency departments, but what we all recognise that these issues extend beyond emergency departments and in fact to how the hospital flows in the back, which I think I mentioned previously. So one simple example in terms of pharmacy and the role that they play within our hospitals, for example, is around patient discharge and ensuring that people are adequately equipped to leave hospital and have their discharge medications, prepared and so on. But look, I don't want to provide... I can't give you an overview of all the outcomes of the day. The point I'm making is that we've had the day, and this is what we do here in New South Wales. We work with our clinicians to improve our system, and it's not just the emergency department staff, it's people who contribute to the general flow of our system, including primary care. We had GPs in the room as well. So it's really important for us to think about how we can improve.
I'll pass back to my colleague in a moment, but of course you would have raised with the pharmacist representative, or they with you, the matter of the significant shortage of pharmacists in New South Wales public hospitals?
We did not discuss that, no. But I
Even
think
though that featured significantly in the evidence in the ramping inquiry that
this
you were
was
present
a
at.
brief introductory discussion, Mr. Donnelly. It wasn't an extensive conversation. I think it's well documented that health disciplines and other skilled workers are in short supply. We understand that. We're working with our colleagues on that. But this was a meet and greet type of situation rather than an in-depth conversation. The team, and there were very senior people there, including deputy secretaries, local health district chief executives. The ambulance service, of course, was represented in this forum. And as I said, it went for a number of hours. It was only yesterday. And so the outcomes of that and the way forward will be provided to me in the coming weeks.
But as you know, the shortage of pharmacists is historic and goes back for decades, doesn't it?
I can't comment about
Can't
that.
comment, okay. Oh, I've got yours.
Can you tell us on notice who attended the roundtable? Provide us with a list.
Yeah,
of
sure thing.
How many people roughly?
I would say probably 40 or 50, something like that. Yeah,
And how are
roughly.
they selected?
I'd have to take that on notice, Ms.
Okay.
Hussos. Yeah.
Yeah, and if you can then tell us if are you planning follow-up meetings, or what's the action steps from that? Is this going to be a regular thing?
Yep. No problem.
Has there been one of these before, or is
Look, we have roundtables on a variety of things. So we've had them on surgery before, for example, with getting surgeons in the room. Generally, what we do is we invite representatives of. So Dr. Skinner, as a case in point, representing the College of Emergency Medicine, would be there. And other that. Generally they're people that are representing craft groups or associations or organisations, but happy to provide that information to you, no problem.
Yeah, so if you can tell us on notice a list of the attendees, what's the action items from the day, and then if there's going to be a follow-up meeting and any other sort of useful information, and what prompted the meeting?
Look, we listen really carefully, obviously, to our clinicians. We know that people came to the inquiry and expressed views, and I addressed those when I attended.
So the
as
inquiry
well.
prompted the roundtable?
No, I think that look, this is not the first time we've had discussions with our staff about how our hospitals work. That's what we do. It's our
It's
job.
a regular event.
What was the specific topic of the roundtable?
Well, it's about improving our emergency department flow, but really, emergency department flow is reliant. It is not sitting there in a bubble on its own. It's contingent on what happens at the back of the hospital. It's contingent on primary health care. It's contingent on a whole stack of things. And you'd be aware we've had a clinical council operating during the course of the pandemic in particular. And a number of the representatives from that were present. So this is an opportunity for us. I would think that when parliamentary inquiries, for example, and that is not the only reason, we would talk to our staff, of course, but you'd expect us to listen to their concerns and then try to do something about it.
Yeah, I'm just interested in why what prompted it. Was it the inquiry? Was it just...
No, I wouldn't say it was solely the inquiry, but if you've got people out talking about the health system and raising concern, look, we have lots of opportunities for our clinicians to raise issues with us. Clearly emergency departments, and I think, we've talked quite a bit about pressure on health systems across the country during the pandemic, before the pandemic, after the pandemic. The issue is that it's our job to listen and to learn and to think about how we can do things better. That's why New South Wales performs better than anywhere else.
So, unfortunately, Minister, I recently had to, full disclosure, had to visit an emergency department with a family member. I noticed some signs that have appeared in there. They started with, this emergency department is extremely busy. And then it tries to provide some directions. It goes to pharmacy or health direct or GP or emergency department. Are you aware of these posters, Minister?
No, I'm not. But I mean, at the recent health ministers meeting with Minister Butler and all the other state and territory ministers, they were all talking about ways to try and do what we've been doing, which during the COVID pandemic particularly, we were regularly, in fact, I remember the Commissioner stood up talking about the fact that our EDs were often having people attend them who were not really emergencies. Emergency departments are for emergencies. And what we were finding, and still are finding, is that because of the GP shortage, this is again Australia-wide, all ministers were talking about this issue, all health ministers, majority Labor. The fact is that we're seeing more and more 5/6s coming into the emergency departments because they can't get in to see their GPs. And Minister Butler has acknowledged that's a huge issue, and I accept that from Minister Butler and the federal government, they're trying to do their best, but it's a huge challenge because trying to get GPs in some...
Minister, we'll come back to the question of GPs in a moment, but I
that's
just want
what
to ask
impacts
you specifically about the posters. Are you aware of the posters?
Well, I haven't even seen the posters you're talking about. Have you got pictures of the posters?
I've got a photo on my phone, but I mean, I might ask the Secretary if she's aware of the posters.
No.
I don't even know what hospital you're talking about. There's 400 health facilities in New South Wales, so there's 400 different, at least, hospital management systems.
Yeah.
They run their own race to a degree inside the network. I can't answer that, Courtney, but if it's a
badged
big
with the
deal
New
for
South
you,
Wales
like every
government
other
logo.
Labor member, you could have come and talked to me about it, and I could have inquired before this hearing.
Minister, I'm just saying it's got the New South Wales government logo on it. I thought I've got the opportunity here to ask you. I'm interested to know whether
You've
this
got
is
my
something
number,
that your
Courtney.
role...
You could have rung me up at any stage, but anyhow. And I would have rung, if you had rung me, and I will once you tell me, I'm presuming you're going to tell me privately what the hospital is, I will personally ring the management and find out what they're doing.
No, I'm just interested to know whether there is a program that's being rolled out across the state. With
Well, I don't think there
posters
is. No one's told me, but then
encouraging-
sometimes the minister's the last one to find out. Madam Secretary.
Not that I'm in regard to these posters, not that I'm specifically aware of, but I guess what I would say is that we've been doing a lot of work to try to help people who may not need to come to an emergency department find another avenue if their illness is less serious, because we've said many times in media and also in these hearings that people with less serious illnesses will wait longer. Our emergency departments are geared towards treating those with the most urgent of illnesses. And so, for example, we use Health Direct to assist people. The ambulance service has got a virtual
Can you
centre
explain
that...
what health direct is, please?
Well, Health Direct...
It's fine. I've used
Yeah.
Health Direct many times. I'm sure others have as well.
You know,
It's
there
completely
are...
fine.
And I
process.
guess the
I understand.
the message is...
My
you know,
time's about to
yeah.
expire. I wanted to come back to the Minister. You specifically said the issues of GPs. Dr. Liz Swinburne, who I'm sure you're familiar with, a senior emergency physician at Royal North Shore, she actually said specifically during the inquiry, one thing that keeps on coming up is that access to GPs is a big issue, and I don't think that's the case. Minister, this directly, contravenes what you are saying.
Seriously, Courtney, you'll find doctors who all have their views. They are very strong-willed people. They're very intelligent people. Does that make them right? No, it doesn't. And what we do know is that every minister in the country knows that it is GPs, and the federal minister, your federal Labor colleague, Mark Butler, who's a very good person, has acknowledged that as a huge contributing factor.
But Minister, that's
I've answered the
directly
question, Courtney.
contravening what
Answered the question.
the evidence, the sworn evidence that was provided to
I'm
the
not.
inquiry.
I've said at the outset, Courtney. Look,
Perhaps...
I will say again. Sorry, what were you going to say?
No, I was just going to say, look, that the experience of an individual, we have to take on board what they're saying. However, we have also got sworn evidence in that inquiry, and we certainly have had very loud feedback from our system about the challenges that people have in getting in to see a general practitioner. And that's in no small part due to the workforce challenges that they've experienced. New South Wales Health Emergency Departments see 1 million triage 4 category patients a year. So in any triage category, they are the largest number. Now, I'm not suggesting that all of those patients are GP type patients, but there will be a significant proportion of them who are. So, there's a lot of work happening across the health system to help people, rather than self-selection about where the best place for them to go is. We're really trying hard to help our community get the care that they need in the most timely fashion possible.
Ms. Pearce, I appreciate that. I just want to come back to the Minister because my time's about to run out. Mr. John Bruning, the Chief Executive Officer.
Sorry, Courtney, I missed that start off.
Mr. John Bruning, the Chief Executive Officer of the Australasian College of Paramedicine, said to the inquiry, our health system is no longer fit for purpose. Ultimately, ramping an access block highlights a health system in distress. Do you think Mr. Bruning is incorrect?
Was he talking about the Australian system? How do you know what he's talking about there?
This was evidence
if
that
it's
was
across the
provided to
Australian
the New
system-
South Wales inquiry.
Was that
into
specific
ramping.
question asked about whether it was New South Wales?
I'm putting the quote to you, Minister. What's your response?
Well, I'm putting to you what was the specific question, Courtney, that went to him. Answers are in
Minister,
context. What?
This is the quote that was provided to the inquiry. Our health system is no longer fit for purpose.
Well, look,
Ultimately,
that's
ramping
wrong.
an access block highlights a health system in distress.
Yeah, it's the health system in New South Wales, as in the entire Western world, is under stress. It's under stress for a range of reasons, not just COVID, but also a lack of access to a number of various clinical areas, so nurses, doctors, but also GPs outside. The whole system is one aggregate, is one network. So to try and pick up on one little piece, I'm sorry, it just doesn't cut it, and it's just all a bit silly. The number of meetings that I have been to.
Order.
The number of meetings.
Minister, it's not up to you to reflect on the member by referring to the question as silly. You know that.
I didn't refer to the member. I actually like this member. I was saying the issue is a bit silly. What I was saying was it's silly to actually have this system our particular system as being any different, except that it's a lot better than any other system in the nation.
Well,
and it's also, I was
That's what
recently
you
in
might say,
Canada.
Minister,
Canada
but
has the
that's
same
directly
problems.
contravened
United
by the
Kingdom
evidence
has.
provided to the inquiry.
That wouldn't be the first time, having seen some of it and the way the inquiry is conducted.
If I may, we
Well,
did
see,
make...
Minister, that's classic Minister, isn't it? Classic Minister Hazzard.
it is.
Just reflecting on the work done by this committee. It happens every time we have a hearing. It's all just dismissed
Nancy,
like
stop
that.
calling me back.
It's all dismissed like that. Typical arrogance of the Minister.
Chair, if I may just add one comment though.
We move over to the Honourable Kate
We
Fairman.
provided a submission that clearly, with publicly available information that talks about the performance of the New South Wales health system compared to other states. That was submitted to the inquiry.
Yeah, we're well aware of that. And this is the Portfolio Committee number 2 looking at the New South Wales health system. Kate Fairman.
Thank you, Chair. Good afternoon, Minister,
Okay.
and all. Minister, I did just want to go back to your comment that you made in March budget estimates. Was it March? Was it that long ago? No, or March, I think, when you said that ambulance ramping was actually very rare now in New South Wales. So just to be clear, I think you said to Ms. Housos that you stand by that comment from that time.
And in the context of what the Secretary's also put, yep.
Is it very rare? Is ambulance ramping very rare at this current point in time in New South Wales?
Nothing much has changed on that front. It does happen from time to time. I mean, we had Blacktown Hospital a couple of days ago where I think receiving a number of people coming in at one time when the ED was already busy and the hospital was full. They had people coming in from multiple car accidents. So, of course, it can happen, but it's not something which is anywhere. It is not a problem for New South Wales in the way that it is for every other state and territory.
Can I check then, has ambulance ramping, we heard during the ambulance ramping inquiry from medical emergency specialist staff on the front line who were telling us that the hospitals were full, basically. A lot
I'm
of
sorry, I missed that, Kate. Say it
the
again.
hospitals were full.
They
That
are.
the ideal is an 85% capacity to deal with the unexpected car accidents and other things. A lot of the hospitals were operating at 100% capacity consistently. Some of the evidence from a couple of the specialists, particularly those working in Western Sydney hospitals, that every single day they arrive at 8 a.m. and there is 20 people waiting. One of the doctors said it's a common everyday occurrence for 30 to 40 people to be in the emergency department when he arrives, with 10 to 15 waiting for beds because there's simply no beds. Again, operating at 100% capacity. That was 4 or 5 weeks ago, I think, with that hearing. Has that improved?
Look, I can't give you a moment in time of what's happening out there right now, but it's raining today, so I would imagine that quite a
Ms.
few.
Pearce, then maybe has the
I'd
system
imagine. Can I
improved
finish,
since
please? You
5
asked the question. I'm
months,
answering. Kate.
weeks
My
ago?
turn.
Sure.
My turn.
Maybe Ms.
My
Pearce
turn.
knows a little bit more.
So from time to time you will have the additional pressure, but the hospitals are under pressure. Again, meeting with all the health ministers only 2 weeks ago from around the country, every one of us have chockers hospitals, largely because of the problems of federal government issues around the number of people with disabilities or waiting to be categorised for NDIS categorisation and or aged care. So as at yesterday or the day before, I asked the question from health, and I think I was told we have the equivalent of two level 6 hospitals, one level 6 hospital occupied by people who shouldn't be there. What's the federal minister that looks after NDIS?
Bill Shorten.
And Minister Shorten has been meeting with us as well, all the state and territory ministers, and to his credit, he's actually acknowledged the problem, and he's doing everything he can, but it's a hard challenge. And as a result, the state system is picking up a lot of the work for the federal government. And there are people who really, it's not fair to them. They shouldn't be in there, because if it was my mum, my dad, I wouldn't want them sitting in a clinical environment. They should be in a home environment. But it also impacts on the hospitals around the nation,
Yes.
not New South Wales.
Yeah,
We are not, out there by ourselves. The only thing that's out there by itself is that we are far better than any other state or territory. Far better.
Thank you, Minister. That's exactly the evidence that we heard throughout the ambulance ramping inquiry as to some of the reasons behind bed block. They're complex, yes, NDIS, mental health patients, other things. So firstly, the question is around hospitals being at 100% capacity, which we heard again during the inquiry itself, how many hospitals were. Do we have an indication of how many hospitals are currently at 100% capacity?
Kate, nobody could answer that right at the moment, because as we are sitting here, there are patients being discharged, other patients walking through the door. They take snapshots, they do the reports, they're all made public. If you want some further information on that, fine. But
Okay.
and I'll ask, is there
Well, we'll
any
take it on notice.
of the senior staff here who know the answer to that right now? No.
I can offer one comment in regard to that, which goes to the point you're making, Minister, is that it ebbs and flows. It's not static, and it is not correct to say that hospitals are at 100% capacity constantly, because the way hospital flow works is that there is a natural ebb and flow that occurs each and every week. So by this time of the week, what we see is, generally speaking, hospital occupancy starts to come down leading into the weekend, and it goes back up and it comes back down. And this happens week in, week out. And that sort of goes to the issues. The Minister's mentioned the challenges that were experienced at Blacktown, I think, on Monday. As of today, they're still very busy, but they've been able to offload their ambulance arrivals above the KPI. So it's not, every day is not the same, I suppose, is the answer to it. The issue with hospital beds was something that we did discuss, the team did discuss with the participants in the meeting yesterday, and I think there's quite a lot of evidence around that we need to explore. But I may have mentioned this before, but the reality of it is that beds don't solve the problem. And the reason that they don't solve the problem is that if everything around the hospital stays the same, so the issues with the NDIS, the issues with residential aged care, and so on, the issues with discharges don't change, then basically what happens, and South Australia has experienced this and they've told us this, that they added 100 beds to their system in an effort to reduce their ambulance problems. It has actually not helped at all, because you have to look at the whole system, not one part of it. And that was really the what we've been doing for many years, and in particular part of our discussion with the team yesterday.
Thank you, Ms. Pearce. And yes, there's no doubt. I think all of the committee members would agree that we do have to look at the whole system in terms of easing the pressure on our emergency departments and what's happening there. I did just want to get your response, Minister, to what appears to be over a couple of decades a reduction in the number of hospital beds available in hospitals and throughout New South Wales, which I think has been a government, a policy decision, in other words. So I visited Westmead Hospital recently. I think we spoke about that. Thank you for getting me access to meet with some of the staff at Westmead on that day. That was very much appreciated, because I literally did it with 2 hours to spare, and I thank you for doing
Pleasure.
that. They told me that, one of them told me that in 1997, Westmead Hospital had 900 beds and it's got 553 now. Given that in 1997 the population for New South Wales was, just for as example in terms of population increase, but population for New South Wales was just over 6 million. Now it's over 8 million. I'm just wondering why yes, it's not just about additional beds. It has to look at the whole system, but that's a kind of alarming decrease in the number of beds at one of our major hospitals in Western Sydney, isn't it? When the population in Western Sydney is growing because new suburbs.
Yeah, again, it's not that simple.
Why is the government making these decisions to reduce beds?
Well, I'll just remind you that you just quoted 1997. Between 1997 and 2011, it was you, I think, in coalition with the Labor Party that were making those decisions. That is the Greens.
I don't
and
think the
Labor.
Greens had anything to do with anything about hospital beds back in 1997.
You helped Labor stay in
Minister.
government. You helped Labor stay in government. Look, I think the reality is that there were a lot of beds closed under Labor because simply they couldn't manage funds, they couldn't build hospitals, they couldn't build new hospitals. Hospitals, though, are not standalone, they're networked. We have a massive network of incredible world-class health facilities that have been built with many extra facilities right across in every area, not just beds. I'll ask the Secretary to answer any additional answers, but that's my answer at this stage.
Do you know whether since 2011 then, are there more or less beds?
Concentration has been to build hospitals, and with hospitals come beds, but not always do you have more beds. It just depends on the particular location. There's another hospital that might be not that far away doing different things. Then the health people work that. That's not a.
I might just get
Kate,
if that could be
that is
taken
not-
on notice in terms of that detail if you don't have it.
Yeah, but I'll just say, I have never, ever, ever in my, whatever it is, 6 years as health minister, ever been asked by this secretary, the former secretary, or any officials, do you think we should have less beds? They work that out because they are the experts. So if you want an expert answer, ask the secretary.
I might just add one comment that, and we touched on this at the ED inquiry, so I won't repeat myself in regard to that. But look, modalities of healthcare change. So the reality of it is that across the health system, the way we provide care now is quite different to what it was in the 90s and even the 2000s. And, look, I'm going back a while now, as you can possibly tell. But, when I was practicing as a nurse and working in coronary care, if you had a cardiac event, you'd be in bed flat on your back for a week. And we didn't let people up out of bed, which when you think about that in hindsight now was really quite ridiculous. The reality of it is that the changes of modalities of care are so significant that the bed numbers, look, I'm not suggesting that we don't need more beds in certain areas, and that's what the investment around our capital has been, but it's not solely the issue at play here because of the way we now deliver healthcare. And a lot of surgery, for example, is day only now, where it once would have been many days in hospital. You used to have to come in the night before. Now you come in on the day of surgery. There are many examples I could give you. as to how we've been able to improve the efficiency of our hospitals over the years, but still care for our patients in a safe and careful way.
Thank you, Ms. Pearce.
And during the period, I've just been advised by my staff that the figure that was put publicly was there were 2,000 beds closed during the term of the former Labor government. So
this government, do you have that figure?
Labor, no, I don't. No.
But could you ask your staff to dig that up too while they're texting
Sure,
you
but
about the
I think
former
you'll
government?
find that, as was
would
just
be-
said,
that would
there's a
be
whole
useful.
difference in modalities in terms of the way you're treated.
We've opened new hospitals. So
Everywhere, right across the state.
big growth.
So, Minister, during the ambulance inquiry, we heard from witness after witness after witness after witness who was telling us that additional beds were needed. Will you commit today to saying to your department, find more beds for the health system?
What, because you had some witnesses saying that and they're the experts, are they? No, I won't. Of course not. I run a health system. I'm actually in charge of 160,000 people and a $33 billion budget, and I won't do that. Any issues that need to be considered will be considered and are considered on a daily basis. So just sitting here asking me to do that, that's a silly thing to do and I won't.
Well,
No.
Minister, the last
Well,
time...
once again, Minister, can I just invite you to be respectful and instead of...
Well, if the
no,
questions are
Minister,
sensible-
well, in your opinion, Minister, it's always...
I'm
your
entitled to
opinion.
that. I'm entitled to that. That's what I'm here for.
I
It's my
understand,
opinion.
Minister.
I was asked for
but-
my...
Yeah, but we don't normally
Anyway, I
refer
get
to
it, right.
answers as being silly. We try to be respectful.
Minister, when I asked your secretary about this issue during the ambulance ramping inquiry, there does come a point, actually, where the public service says to us, they're not the government. There is, and this is
I'm
what
sorry,
Ms.
say that again?
Pearce. This is what Ms. Pearce said to me. There does come a point during this. These estimates, when we're asking or inquiries, when we're asking public servants about particular things, we get pushback saying, we're not the government, that's a policy question. That's why I'm asking you right now about additional beds. Because when I was asking Ms. Pearce about the state of the system, about the fact that, the situation is dire, could we get additional beds? Is that a response? Of course, we can't get that from the public service. You're here now as the minister. You have the ability to say whether or not New South Wales will get additional beds to deal with the crisis in our public hospital system.
Okay, and I'm saying
Your
to
call.
you, I'm not allowed to say it's silly, so I'll choose some other word. That question is a very narrow question. What I will say is that the state government is spending more than the coalition of the Greens and Labor did in their period for 16 years. And already there's another $11.9 billion worth of new hospitals being built just in the next 4 years. And the advice that we will take is from the health experts as to what should be done. And the only argument about that would be if we weren't giving an extraordinary budget to the health officials. But the way it works is each hospital that is being built and redeveloped, the clinicians put in their 2 bobs worth to the clinical services plan. That isn't perfect like anything else because obviously the clinicians in that hospital would like bigger and better for their hospital in various wards. There may be doctors from other areas that should be having their input. That doesn't always happen. But a clinical services plan that comes up, it then goes to health infrastructure. They determine master planning. They determine how many beds can be done, but there's a budget. How many X-ray bays? I mean, we've currently got a situation where we've got new X-ray units, as I saw in Dr. Claire Skinner's ED only 3 days ago, where now the new model is, if you can do it and find sonographers, which is almost impossible, or radiographers, have an X-ray department, a smaller one in the ED. These things are changing, and to ask that question is simply, I can't give you a definitive answer on that because it's actually not the question that is asked by the health people. It is not the way it works.
Minister, has New South Wales Health made any funding requests to you for ongoing operating costs associated with major hospital bills that have been rejected by your government in recent years?
Sorry, can you repeat that question?
Has New South Wales Health made funding requests for you for ongoing operational costs, recurrent operational costs that have been rejected in recent years by your government?
I don't recollect that happening, but I'll just...
I think this issue came up at the ED. I think I was asked about this at the ED inquiry, and it was with respect to a media inquiry, if I recall correctly, that was referred to.
So,
Is that right?
well, regardless of the question is, have there been recurrent?
I'll take that on notice. Can I tell you though, again, the recurrent funding is at a third or close to a third of the state budget. It is huge. That's before you even look at what the federal government are putting into primary care and all of the related matters that they have to pay for. Probably it would be at least double, maybe more than that. So there has to be some common sense and there has to be some management of how the budget works, because taxpayers don't want to be paying all their money in tax. So it's a balancing act.
I
I
understand.
can tell you that the biggest budget in the state is $2.7 billion for one local health district, which is bigger than the.
That's fine. Thank you, Minister.
Which is
That's
bigger
not my
than the
question.
budget for
Thank
Tasmania,
you. I'm
bigger
just
than the
going to go
budget
back
for the
to my
ACT.
question now, because you're starting to diverge onto a lot of other issues that I wasn't asking you about. So this is about. You know, I have given you a fair bit of leeway to talk as you wish, but I understand that in 2019 to 20, there was a application by the Ministry of Health, recurrent funding only, that was approved. I understand that then there was one for the next year, which was for $510 million by the Ministry of Health for ongoing operating costs of the 2020 to 21 major hospital bills. That was for $520 million. That was rejected. And then I understand in the next year, there was the same application, for ongoing operating costs for the 2021-22 major hospital bills. That was actually for $2.3 billion over 10 years. That was also rejected. Why is your government rejecting applications by the Ministry of Health for ongoing operational costs funding tied with the new hospitals that your government is opening? Why aren't you agreeing to what is clearly essential costs for Ministry of Health for their operational costs? I understand Cabinet has rejected these.
So if you were running the state's budgets, the Greens would just simply hand over the
Mr.
entire
Answer
state
the
budget.
question. I'm
Is that what you
actually
said?
asking serious questions.
And I'm answering it seriously.
Your department has recognised that you are opening these hospitals, all over the shop. They do not have enough
Thank you for
operating
acknowledging that.
costs.
Thank you for acknowledging
They
that.
do not have
Thank you.
enough operating costs. Your department has said several things in relation to that.
Can you quote that to me, please?
I will find it in a second. Here we go. That the $2.6 billion over 10 years.
I'm sorry, who said this?
This is a cabinet in confidence document that the Saturday paper mentioned Rick Morton in an
article. It's a cabinet in
article
confidence
on.
document that you're reading from a newspaper, and you're telling
No,
me
I
that's
happen
a
to
fact.
have the cabinet in confidence document in front of me.
I'm sorry, I think the standing orders are that you've got to produce the original document for me to comment. I won't comment other than to say this. The budget
I
has
don't
gone
think
up
that's
by...
right, Minister.
I've got the standing orders here if you want me to look at them.
I'll go for your life.
10% increase in our budget last year, Ms. Fairman. So again, if any one of the state ministers and territory ministers had their choice, we'd have 100% of the state budget. But as we all acknowledge, that's not the way it is in the real world.
I'll come back.
Honourable Courtney Eusos.
Thanks very much, Mr. Chair. Minister, you would be aware of the recent data breach with Medibank, where 4 million customers have had their personal and health information accessed through a
I've seen the
data
media
breach.
reports, yeah.
So are you aware of what information, if there's been any information that's been provided to Medibank by the New South Wales health system?
I'm sorry, ask that again, Courtney. What?
Has there been any information provided by the New South Wales health system to Medibank or AHM that has been accessed as part of the data breach?
Does anybody know the answer to that? I wouldn't have thought so, but does anybody know?
Minister, you would
Take
be
it on
aware
notice,
that
Courtney.
private patients can...
Courtney, I have to take on notice. All the senior executive are here. You've got the entire health team here at the moment, and no one knows. So, sorry, I'll have to check it.
You would be aware that private patients in public hospitals can use their private health insurance. I'm interested to know whether that information has been provided to Medibank.
Well, again, you've got every senior executive here from New South Wales Health, and no one can give me the answer to that question, can they?
If I may, Minister.
Oh, Alpha wants to tell you.
Alpha.
We've just been
Thanks.
good afternoon. We've just been alerted this morning that obviously as part of the billing process, as you mentioned, but we are not aware that any of the details that we provided have been subject to this particular attack.
Sorry, can you say that for me again?
As you mentioned,
Yes.
obviously we provide information to Medibank as part of
Sorry, just the
billing-
microphone a bit closer, that's all. I just
billing-
can't quite hear you.
as
Very
part of the
quiet. Just
billing
speak up a bit, I'm sorry,
for
can't
private
hear.
private health insured patients, and therefore we are looking into that as we speak. But we don't believe there has been any at this stage. We're looking at
I think what I'm hearing from Alpha is he's just heard something this
That's
morning,
right.
but they don't have any
Yeah.
information yet that there's any data being given out. So,
Yeah.
So,
but if there is, Courtney, then obviously that would be something that Health will make public as soon as.
Ms.
know
Hughes, Zoran Bolovic, our head of eHealth New South Wales, just sent me a message to say that it's not known as yet. So I think they're still examining all of those details. And obviously, if it does become known, we will do what we normally do, and that is advise people in conjunction with whatever Medibank Private's doing. But those details are not yet known.
okay, so Mr. D'Amato, you were just saying though that you were alerted this morning. What was the form of the alert?
That's exactly
Of
that.
that, yeah.
That's exactly that from the CA.
Sounds like it's come from Zoran Bolovic, who
That's
heads
right.
up eHealth. So he would be looking at all those issues. If there's some public, the way it works is someone's raised it publicly or someone's indicated privately, maybe from Medibank, and so they're now tracking it all to see whether there is any implications, but it's impossible to say. But when they get that information, if they're certain, they would then make it public because that's a necessity.
Yeah, I mean, you would be aware it's been publicly reported that significant amounts of health claim data have been accessed
Absolutely,
through the data
yeah,
breach.
it's quite concerning. Yep,
Yeah,
very
and
concerning.
people's personal health information
I'm
is
very aware of that.
incredibly
It's
confidential.
extremely concerning at a very personal level. Yep, that's
Yeah,
true. Yep.
absolutely.
Mm-hmm.
So, Minister, would you be open to then introducing new protections or providing additional
You
protections?
mean from Zoran Bolovic? I don't think you've asked for him today, but Zoran is the head of eHealth, and that's a constant discussion that I have with Zoran, and I'm sure the health team do, to make sure that they're doing all they can to have cyber security around the issues. Is it possible? Well, of course it's always possible because, as has been evidenced by some of the biggest organisations in the world, there's some very capable criminals out there. But we're trying to do. Well, I'm advised that eHealth is trying to do everything they can to prevent that.
So I understand that as a result of the Optus breach, the federal government is looking at certain different ways that companies can be storing data. For example, citing documents instead of actually providing documents. Is that something that you would look at given this kind of breach?
Courtney, this is the highest of high-level cyber security. The people who are the experts in that are not currently located in the New South Wales Parliament as members of Parliament, and I'm one of them. So I'll leave that to the advice that will come in due course.
No, and I am also
But I'll
not
just say
an
again,
expert in this.
anything that can be done, I would expect New South Wales Health to do because that's their job. We've got millions of people's information, so obviously it has to be as secure as possible.
Okay, but so you were so the eHealth was alerted this morning that there may be some kind of breach. Can you just outline what the process is then, Ms. Pearce, perhaps?
Look, generally what happens with these is they, given the complexity of it, I think we're dealing with 4 million members
In Medibank,
in Medibank.
not New
yes,
South Wales
yes,
Health.
no, Medibank. That's why I said members. And they go through the issues in terms of what they can see has been released, and then you can imagine the trees that come off that in terms of lines of inquiry and investigation. We will be notified, as I'm advised by our head of eHealth, that if any of our records or any involvement with New South Wales Health in that will be notified, and then we will take the appropriate course of action. Cyber New South Wales obviously takes a leadership role in these types of issues, so we notify them. If necessary, we notify the New South Wales Police as part of that process, and then we would work through it. So it's impossible to answer that in a simple way in here, because until we understand what the actual issue is, and if indeed there is an issue, we have to just take it when the information comes to us.
And federal health and the federal minister is obviously very concerned about this as well for Medibank. and they're working flat chat to try and work out exactly what's gone on. They then share that information with states and territories if they find something. So there's different avenues of information going to come to us, but at this stage that information has not been made available.
Yeah, but I mean, this is obviously one instance of the breach that's occurred.
Sorry, Courtney. Say it again.
Sorry, this is obviously one instance of a breach that's occurred with Medibank specifically, but I'm interested to know if the New South Wales health system is looking at doing things differently as a result of this kind of breach. We know that we're going to have
Courtney,
more
they don't
of
know
them.
yet what.
Sorry, Minister, if you'll just let me finish. There is obviously, there's been a particular data breach. I appreciate that we're still waiting to find out exactly what's been accessed. I'm interested to know if the New South Wales health system is looking at different ways of providing the data, because we know these breaches are going to continue to happen. I think I saw someone talking about it being the armed robbery of our time. This is something that is ongoing. It's going to continue to be a challenge. I'm interested to know if you are looking at
3 weeks ago,
different
I
ways
opened the Digital Health
of
Conference
managing-
for Australia
Minister,
here in New South Wales.
I haven't finished my question. I'm interested to know if you're looking at different ways of managing the data and particularly providing it to private insurance companies when people access that through the New South Wales health system.
Courtney, 3 weeks ago, I opened the Digital Health Conference here in New South Wales. There were literally hundreds upon hundreds of digital experts, cyber, IT, there at that conference. This was one of the topics they're all talking about around Australia, as you'd expect. It's at such a high level that, of course, and in fact that was co-hosted by New South Wales eHealth, which is why it was actually here in New South Wales, down at the International Convention Centre. It's the most complicated of areas. There are attacks on major companies and governments all across the world. Every major company and every health authority, every government agency with your data in. There are numerous other government agencies that have all the data. All that is under constant review, literally daily, sometimes minutely, trying to look and counter the criminals that are out there working against this. So eHealth are working on this all the time. And answering your specific question about Medibank, well, when we get the information and they've got it, they will be looking at it and they'll be doing everything they can to make sure that our systems, and there are a range of systems, are all as immune, and I won't say immune, but as immune as is humanly possible.
Ms Hughes, I just might add to what the Minister said there, if I may. Every single time there is any form of cyber attack, everything is examined as to how the security can be improved. And I think that's like all organisations across the world, you'd expect us, because they find new ways of doing things, and so consequently we need to also upgrade our systems if necessary. It is really important that we do that, because we understand the sensitivity of patient-related information. So we will continue to do that.
You go now. I'll just pass to my colleague.
Thank you. Minister, I'd like to take you now to some questions about Fairfield Hospital, quite specifically. And you would recall that this committee undertook an inquiry that got underway in February 2020 into the current and future provision of health services in southwestern Sydney's growth region. And as part of that, there was a fair bit of evidence, actually, if you go through the report, about matters with respect to Fairfield Hospital. And you probably would recall some of the reflections that were made in regards to that facility. We understand that presently there is a petition that's collected several thousands of signatures, literally begging for an upgrade to the Fairfield Hospital. And the question that's raised is, how long will we have to wait? How long will the citizens of that area have to wait for the works to be got underway with respect to what needs to be done at Fairfield Hospital?
Again, Mr Chair, the hospital system is a network, and in that general region there are billions of dollars being spent on new hospital facilities. Fairfield Hospital, the local federal member, Diley, recently asked me whether she could visit, and of course I said yes. She also took along, I think, the Labor mayor from the local area. Then I had some discussions with her afterwards about what areas she wanted to see a focus on. But there has been quite a bit of work done on Fairfield Hospital already. If you like, I'll take it on notice as to what the actual work has been done. But I remember seeing a briefing note shortly after Di had been there and when she rang me to discuss the issues.
Yes, if you could take that on notice, because that will be interesting to review, because the matters in the Broad raised back in 2020, at least some of the significant ones, are being restated as issues with respect to that facility. So is there, so this is getting down to some finer detail, are there plans that have been effectively completed and ticked off with respect to the overall upgrading of Fairfield Hospital? In other words, as a facility itself, a standalone
Are
facility
you meaning
itself.
to completely rebuild the hospital, or?
Well, I use the term in a generic sense, the broad sense, to upgrade the hospital to. I mean, the hospital is approximately 34 years old, as you would be aware. And to the best of my knowledge, from the information provided, it hasn't received an upgrade over that period of time. So that's leading to the questions that the community, the clinicians and others working in the facility, and the nursing staff and administration, and the community around the hospital are raising.
There's no question that because of the enormous expenditure that the Liberal National Government has made in its now nearly 12 years on new hospitals across the state, which was not done under the previous 16 years.
That's just not true.
Anyway, let the Minister
I
finish.
missed out on who said that's not true. Who said that?
Me.
It is true. It is absolutely true. I'll put you a $50 bet on the fact that you want to put it side by side. You did absolutely almost nothing, and I was here. Anyway, back to the topic in hand. So I think what I've seen is understandably an expectation from the community that in various areas that they would like brand new hospitals absolutely on their street corner if they could do it. Fairfield is an amazing community, very multicultural community, and a lot of the services are directed to those broad community members and very targeted. But I know there have been, as I said to you, money spent on the hospital in terms of extension. That, can I tell you, it's a bit like, Sophie Kotsis would like, and I would like, Canterbury Hospital upgraded as well. And we've talked about that, I think, in one of the many inquiries, Mr Chair, that you have the pleasure of chairing. And I've spoken to Sophie about it too. But it comes down to the government, not once in the entire time that I've been minister, have I ever made a political decision about when a hospital will be upgraded. There's a budget, and what happens then is that the local health district makes the decision and prioritises it. In the case, for example, of Sydney Local Health District, there was Concord, RPA, and of course Canterbury sits in there as well, and it's the next one off the block, a starting block. Over at the southwestern and western Sydneys, there are a number of smaller hospitals, including Fairfield, where the local community, and particularly Di as a new federal MP, would like it prioritised. But just in the greater area of Western Sydney, I know that we've spent recently nearly $6 billion of taxpayers' money. There's no reluctance to try and build new hospitals and build new facilities. It's more just a case of there has to be a budget, and the local health districts prioritise what they believe as boards. There's a board beneath its local health district. Again, I've never given a direction ever to a board or the chief executive on which hospital will get what. It's a matter of them sitting down and doing it in an objective clinical fashion. And I think that's the appropriate way to do it. But look, as I said to you, I'll find out for you. I'll take on notice the issue of what's been done and what other issues might be done at some point so that there's some clarity. But I've also given that same undertaking anyway to Dilay, and she knows that we're working on it currently.
Well, in all fairness and with greatest respect to the good folks who live in the Fairfield area, none of them, as far as I know, are asking for a brand new hospital on every street corner.
So what are they actually?
Which is the
what
phraseology
do you
you
understand?
used.
Well, I wasn't saying it was they were asking.
Oh, no, that's
Saying
what
that's
you
the
said,
issue
Minister.
that often
No, Minister,
arises.
that's what you said, and
I
that's
said
not
that
the
that
position.
would be what most people would like, but it's not necessarily
That's
what
not
the people
what
do.
the good citizens of the Fairfield area.
But I did
are saying.
ask you, what issues do you think should be upgraded? What issues are you talking about?
Well, Minister, there has been an inquiry into this matter, or at least included within this remit of an inquiry that was conducted back in 2020. So you would be familiar with what the recommendations were, specifically with respect to Fairfield Hospital. No doubt you are well aware of those.
You might be
But
surprised.
can I just continue on? That my understanding is that less than 4 in 10, so less than 4 in 10 emergency department patients at Fairfield had their treatment commenced on time, which is part of the theme that my colleague, the Honourable Courtney Hussos, was, and indeed the Honourable Kate Fairman was prosecuting a bit earlier, which you were very keen to dismiss as being part of a political exercise on the part of the opposition and the Greens. So on the matter of less than 4 in 10 in the emergency department, patients at Fairfield receiving treatment on time, what is your response to that?
Well, I'm just trying to find out what you're referring to, and nobody here is actually sure about what you're referring to. So again, I'll take the question on notice.
This is in regards to the emergency department.
Yeah, I was just
performance at
saying,
Fairfield.
what period are you talking about?
This is in the immediate past.
But what period? Not 1 week, 2 weeks, 1 month, 6 months, a year?
Well, Minister, if you don't know, you don't know. So,
I've said that to you, but I'm asking you for clarity so I can get an answer. If I don't have clarity, I can't get an answer.
Mr. Donnelly, I can assist you just in terms. Look, the team at Fairfield do an amazing job. Right now at Fairfield Hospital, 100% of their ambulances are being offloaded on time, and they've got a median wait time of
This is right now, by the way, right now.
Of 5 minutes to see people who are in the emergency department. They are, performing very well today. And I think in respect of future capital plans, as the Minister said, we're happy to take that on notice and provide you with any information that you require in that regard.
and while you're doing that, may I invite you, Secretary, to make inquiries at that hospital at the most senior level to establish, as best you possibly can, whether patients coming to the hospital are being told that they should seek medical attention elsewhere.
It depends. Sorry, Mr. Chair. It depends on what they come into a hospital for, as to whether, if you came into Northern Beaches Hospital and your baby required paediatric cardiac surgery, they'd be told to go to Westmead Children's. That's a very broad and generic question. We need some more specificity to understand exactly what that means. So otherwise, it's incapable of being answered. I'm sorry.
Well, that's
But I'll tell you what I will do I'll actually personally ring the manager of the hospital, and not today because it's a flat chat today, but as soon as I can, and just find out what exactly is going on in that regard. I don't know. I just can't imagine. But still.
well, we understand, and people, as you know, Minister, because you are an individual who is in opposition for a period of time, that people contact you as the Shadow Minister or the Minister, as the case may be. So our Shadow Minister and indeed MLCs who've got duty electorates and sitting MLAs have matters raised with them. You know that very well. So we're being told that the pressure in this hospital's particularly difficult, particularly challenging, partly related to the fact that the hospital hasn't been upgraded for 34 years. And we are told that as a result of that, there is this directing of some patients to, in fact, seek medical attention elsewhere. But we'll pass now back to the crossbench. Who would like to kick off?
Yeah, I'll do it.
Kate
Thank you,
Fairman.
Chair. Great. I just wanted to direct my first questions to you, Dr. Morgan, on behalf of representing New South Wales Ambulance today. What's the Special Operations Team?
Special Operations is a unit within New South Wales Ambulance that basically accesses patients in complex circumstances. So generally speaking, if, for example, a patient was fallen down a cliff then the special operations team would be able to abseil down. Now, of course, that's duplicated in across emergency services. You'd be familiar that there are a number of agencies provide rescue services that can access patients in the scenario that I described. But we particularly like to be able to have our own staff be able to use those skills to access patients. But if they're not trained SCAT officers, we can actually have the rescue agencies lower them down.
I've just got something I'd just like to table for Dr. Morgan, if I can just provide it to him. It's a Facebook post announcing the Special Operations Team from New South Wales Ambulance on the 23rd of September, and that's for everybody. And it's a group of people. Why are they all male, Dr. Morgan?
Well, this was an issue, funnily enough, that I've actually raised as soon as that post came out, and the photograph of the Executive Director of People and Culture. So I've asked, and I've spoken to the Director.
So you repeat when you said that, sorry, what did you do when you saw it?
Immediately spoke to the Executive Director of People and Culture, and I followed up with a secondary conversation with the Director of Aeromedical and Special Operations, and asked them to look at the issues, whether there were any issues around gender diversity within these special units.
Does it reflect something broader? I mean, you're saying like an issue of gender diversity within the special operations team or within HR. I understand that female paramedics did apply, that they've done so over the years. Many female paramedics do apply to be on the special operations team. This person who contacted my office, you can see the correspondence there, that made this the most recent class. Here we are, 2022. Every single member of the special operations team is male. That it makes the female paramedics feel devalued. It's been a demoralising force. It will stick with them for a lifetime. And again, that female paramedics, I understand that it's approximately 50-50 females to males within your organisation. So it does indicate possibly more than just asking HR or whoever it is, executive team, to look at gender diversity, doesn't it? What more are they going to do? Do you know?
Well, I think that's absolutely the first place we need to start, is to decide whether we've got an issue or not in that particular work area, which is the work that I've commissioned. You'd appreciate that there has been significant improvements in gender diversity across New South Wales Ambulance. Over the last 30 years, we've literally gone from a handful of female officers to now being nearly 50-50 across the organisation. There's significant representation of females within the executive. In fact, more of the executive directors are female than male in New South Wales Ambulance, and there's about a 60-40 split in operational chief superintendent or director level. So across the board, in on-road paramedics, it's around 47% are female. And in relation to absolutely becoming aware of a photograph that may represent non-gender diversity, the organisation's taken immediate action with the two most senior people involved. Importantly, look back at the history of special operations is also rescue. Historically, there have been high physical fitness standards, including weights and other sort of things that would have to be 30 kilos worth of rescue equipment, for example, that were all part of the assessments. Now, they have been in the past asked to look at the access exams to see whether they were unreasonably favouring males, and there is a whole new regime in place, I understand. So we're still yet to have some further advice in relation to whether there was a specific issue here or not, but action has been taken.
Okay, so and will that report be made
well, it won't be a
public in any way?
report. No, I haven't commissioned a report. I have asked the Executive Director of People and Culture and the Director of Aeromedical and Special Operations to provide me with advice.
So given the historical nature of what I take is it the Special Operations team being predominantly male, if not entirely, from this point forward, regardless of what they report back, I would expect that there are going to be more women offered roles within the Special Operations team. Dr.
It's fair
Morgan.
to say that I've been very clear in my expectations.
Thank you.
Let's bear in mind, the evidence would suggest there has been significant success in our organisation in ensuring gender diversity. This is an area I think we have further work, and that work's been commenced.
Thank you. Minister, you're going to leave after, how many years is it, 32?
Don't remind me.
I'm just wondering, will you be one of those politicians who it's only when they retire do they suddenly see reason and start calling for a health approach to drug use rather than our current punitive law and order approach? You know, I think Bob Carr does it, Helen Clark,
Sorry, I don't,
Mick Fuller.
I'm not allowed to say the question's silly, so therefore I'd ask you to clarify what you mean by your question. What are you saying? You want me to hypothesise what I'm doing in 5 months? I'll be on a beach, hopefully.
I want you to come back here.
Sorry?
Come back here and answer as a citizen.
I don't particularly want to do that either, and I won't. Look, what's the question? What do you ask? What are you actually asking me? Ask the question now. What do you want?
I'm asking.
You're asking me whether I'm going to
this is
disagree
your last
with
budget
your view on
estimates. This
pill
is your
testing.
last budget estimates, Minister, and I've asked you a number of questions over the years around.
And they were all good questions, Kate. Excellent.
Thank you very much, Brad. But this is it's a question about whether. Well, let's start with the ICE inquiry. Do you think that the government should have responded to the ICE inquiry sooner?
It would have been helpful if it was possible. Yeah, sure.
You were kind of arguing for that.
Well, I won't discuss what I said in Cabinet. But look, I think that the issues of drugs and drug usage is hugely problematic. And I think where we've landed, Dr. Chant actually and I released some funds before the report came out, didn't we? About 23 or 24 million for various issues to do with that. I think, there's as many views as you could ever expect in what is a complex area. I was here, I don't think you were, no, you wouldn't have been, here when Bob Carr did the alcohol and drug inquiry back in...
Drug Summit, yeah.
Drug Summit back in about 90-something, 97 maybe, 95, 97, 97 maybe. And I backed the injecting room at King's Cross when a lot of my colleagues didn't. And I think looking back on it, it was one of the best things that we did because there's been many people's lives saved. I know as a former lawyer in court, I often dealt with young people, often boys, but some girls, who were on drugs, and it was a constant source of concern to me that the legal system doesn't always have, in fact, quite often doesn't have the solution for kids who have got themselves under drugs. So, and I remember losing one particular client, and I had to sit with his dad, and it was just terrible. He'd been in and out of prison. It hadn't helped. So I had no doubt that there's got to be some sort of better way of doing things, and I think there's a balance to be struck. I think the government's position is, I'm part of cabinet, so I'll back that, but. And I certainly won't be coming back and giving different positions, if that's what you're asking me. But I think on things like, the pill testing, I have genuine concerns about that. I've talked to Rachel, who's the ACT Minister, and she's very keen on it, and they're doing work on that. From my point of view, it worries me at a number of levels, not least of which if you've got some young person who comes into a pill testing device, first of all, it's very difficult to get a full-range pill testing response from an automatic device. It's really got to go into a full laboratory situation. But secondly, if I got one pill tested and the kid had bought half a dozen, what's going to make it safe that the other four, what will guarantee the other 5 pills are what was in that? What will do it? So I think these issues are not as simple as some would say. I know you indicated to me one day many years ago that you thought MDMA was, I think it was ecstasy. MDMA, ecstasy was something kids could take. I don't agree with that. I would be worried if my kids were taking it. I'd be worried if any kids are taking it. So it's a balancing act. But I certainly won't be coming back here and giving the benefit of my infinite wisdom after I'm gone. The last thing I'll do is come back to this New South Wales
Doesn't
Parliament.
need to be back here, Minister, just anywhere.
Honourable Mark Latham.
Thanks, Chair. Thanks, Minister, and your officials. Can I just draw your attention to a forum similar to this one? In the European Parliament, about a fortnight ago when one of the MEPs there was
Sorry,
questioning...
what's an MEP?
A member of the European Parliament, was questioning the president of the international markets at Pfizer, Janine Small. And she said, under questioning, that Pfizer didn't know about stopping the COVID transmission before their vaccinations entered the market. What advice did we have in New South Wales before or during the rollout of the Pfizer vaccination program about the effectiveness of the vaccine in stopping transmission?
I'll just say this, that obviously the challenge around the COVID pandemic was we had no vaccines originally, nothing at all. And there were companies wanting to produce them, trying desperately to produce them. Countries desperately tried to get them. Every country in the world was trying to get vaccines. And we've had, the compliments of the federal government, a range of vaccines that were made available. And as information proceeded, there's obviously going to be a development of the knowledge sets. I think, though, that I have seen some commentary amongst anti-vaxxers in the many nasty notes that I get on my Twitter as to this sort of questioning. What I would say is that the purpose of the vaccines from our point of view was to keep people alive and also to make sure that hospitals were not overrun. The fact that it may not have stopped transmission was not the only issue to be considered. But on that note, I shall pass to the far more expert, Dr. Chan.
Thanks very much for the question. And I think this is a really important piece that we need to communicate very clearly. And the messages, to be frank, have changed through the pandemic. So as you're aware that Pfizer, the first real-world studies and the data to support the outcomes associated with the Pfizer product at scale were generated in Israel, and that was because of the good connected data systems that Israel had in terms of connection between their primary health and their hospital system. So that delivered real-world experience about the effectiveness of the vaccines in terms of severe disease. What then became evidence is various publications were published which also showed that you can affect a reduction in transmission in two ways. So first, if the vaccine does have an effect about stopping you getting the disease initially, and then you can also then, even if you get the disease, perhaps have a lower infectivity if you've got the disease. So they're the two sort of ways in which it can work. And the answer is not simple, and I'd be happy to provide more evidence because it's changed depending on the variants. So I suppose if I give an example that the Pfizer vaccine was particularly more effective in terms of the earlier vaccines, in terms of that transmission effect, but what then we became in terms of the earlier variants. And then, but over time, also we learned that immunity can wane against the transmission benefit. So just to be clear, the vaccines have held up incredibly effectively in terms of their prevention of transmission against, in preventing against severe disease, hospitalisation and death. But we know that both natural infection, so infection with the virus, and the vaccine does have some waning. We're still learning a lot about the combination of that immunity between what we call hybrid immunity, where most people in Australia have had both vaccine-induced and perhaps an episode of, particularly with the Omicron variant, and that's hybrid immunity. And we've still got to learn about how long that hybrid immunity lasts and does it protect us. At the same time, the virus is evolving. So, for instance, at the moment, we're seeing the emergence of variants, and all the time the virus tries to evolve in a way to, I know there's been some criticisms of the use of the term evasion, but it's trying to get around the immunity that's been generated. Now, that isn't absolute. So what, for instance, our messaging around when Delta was a predominant, we were saying 2 doses of vaccine was sufficient. We had to change that to 3.
On my question, please, this is all interesting, but
So-
I'm
so
asking a
basically-
question about what advice you received from Pfizer at the beginning of this rollout on the effectiveness of their
Okay.
vaccine in stopping
So-
transmission? Because Janine Small seems to be saying you didn't receive any advice
So
that
just-
indicated that the vaccine would stop transmission because they couldn't give it.
So in terms of the advice around the way the vaccines worked, the structure we have in Australia is we have the TGA is the regulator, and we also have the Australian Technical Advisory Group on Immunisation, which provides advice. Now, as I said, the difficulty with your question is that the information has changed over the course, depending on the time point, and it also has changed. So at certain points, the vaccine, as we saw in the Delta management of the Delta outbreak, effectively worked by actually providing protection and reducing
I'm
the
not
rate
asking
of
about
transmission.
protection and people being better off in hospital. I'm asking about stopping
No,
transmission.
in transmission
at what point,
as well.
At what point did you receive advice from Pfizer that their vaccine could stop transmission?
The evidence, as I said, Mr. Lathan, is more nuanced. We had very clear evidence that if you've got a high antibody level, then particularly if that antibody is well matched to the variant that is circulating, you are protected. So I can provide some evidence to you about the nature of the antibody response, and often the evidence was actually generated by researchers who were looking at the role of vaccines in reducing transmission. But at various
You
points...
can't point to any advice from Pfizer that said their vaccine would stop
we
transmission.
would not generally...
Big point, isn't it?
No. I think just to be very clear here, it's around the fact that the advice that Pfizer provides to the regulators, but there was a lot of real-world research that was done on the way the vaccines both worked in the various ways, Mr. Latham, which were, one, stopping you getting infected in the first place, and they still have some evidence, and I can provide you with a public document we've had with the National Centre.
Notice, was New South Wales any different to the US Food and Drug Administration body, which is their equivalent organisation to the ones you've mentioned in Canberra, where in rolling out Pfizer on the 11th of December 2020, they stated as follows: at this time, data are not available to make a determination about how long the vaccine will provide protection, nor is there evidence that the vaccine prevents transmission of COVID from person to person. Were we any different? Did we get advice different to this US body?
As I said, the regulators are looking at the effectiveness of the vaccine in producing protection against severe disease or any outcomes, and then there's been a subsequent variety of studies that have been looked at which actually tease out these two components. So there's
Are
evidence...
they from the manufacturers? Is that from Pfizer?
No, from researchers that have looked at real-world experience and evidence. And so, Mr. Lathan, I'd be happy to provide copious levels of evidence that we've done, but a lot of this has also been reviewed at the ATAGI
If you
level.
could on notice, that'd be great. And to follow up from Pfizer, what about AstraZeneca? At the beginning of the rollout, did they provide you with advice saying that their vaccine would prevent transmission, that they were doing better than Pfizer?
So New South Wales Health does not receive advice from the drug companies, Pfizer or AstraZeneca. What happens is that advice is provided to the regulators and also provided federal regulators, the Therapeutic
So you didn't
Goods
have direct
Administration.
contact with any of the vaccine manufacturers. And the regulators, what advice did they give you about the effectiveness in stopping transmission?
All of the advice that the regulators have done is published. ATAGI has got a website which has provided its advice when it's considered the evidence. And so the Commonwealth Government website has got significant degrees of evidence. And there's also additional documentation about the various, what's known at particular times in relation to the variants.
But when you fronted all those press conferences and people were locked in their homes and there were curfews and we're all told that, unless you get vaccinated, we'll never get on top of this. Was it your knowledge and expectation that Pfizer, AstraZeneca, Moderna were going to stop transmission?
And they did at that time. So the reason the virus...
Why did you know something that Janine Small didn't know?
I think you're talking about the dates and the times and the duration. So the questioning is more complex in that, as I said, the way the vaccines work is in two ways in terms of transmission. So first, they have a benefit if you don't actually get infected. So at the time of the Delta, if you look at our epidemic curve, Mr. Lathan, you'll see that we got down to a very low level of, and that was a great tribute to the community's uptake of vaccination. So vaccination has served us incredibly well. It was very clear that with the Omicron variant, because it actually had developed some ability to evade the immunity, we needed an extra high level of antibodies, and that was the advice about the needing the 3 doses for the Omicron. And ATAGI is continuing to look at the evidence about waning and this combination of hybrid immunity and providing advice to the Australian public about when we need to have further boosters. And my key message to the community would be continue to follow the advice of the Australian Technical Advisory Group on immunisation and maintain your up-to-date status for the best protection of you.
Thank you.
The Honourable Courtney Eusos.
Thanks very much. Minister, are you aware of how much each LHD spends on contractors and labour hire?
It's not something that I would be involved in, but the budgets for each of the 15 local health districts, for example, Hunt and New England 2.7 billion, so they would have a lot of contractors. Western Sydney roughly 2.3 or 4 billion. South Western Sydney is about 2.4 billion. They would have a lot of work going on for a whole lot of issues, and it depends on, are you talking about cleaners, are you talking about painters, are you talking about doctors, talking about nurses? What are you actually addressing?
I'm specifically interested in labour hire, whether you track that.
For what?
Labour hire across the board. This is something that's been identified by the federal government. The federal government has said that they're going to rule out labour hire for paying different people who are doing similar jobs.
Right.
But are receiving significantly different payments. This often happens through labour hire. So I'm wondering whether
I'm not sure
you or whether the department identifies what
Well, they
labour
would have
hire
all that.
practices
They
are
would
in
have
place.
that. Can I say this? Mark Butler, to his credit, is recognising that there's a shortage of staff, and how money is spent in trying to replace those staff is a challenge in health systems right around the country, right around the world. I'd also just cite, I don't know whether you've had a chance to talk to them, but it'd be worthwhile having, is Adam still here? Adam's still here. Have a talk to the representatives of the Health Services Union, and particularly Jared Hayes. Jared has expressed concerns to the federal government privately, I think, and publicly, that he would like to see a major inquiry, I think even possibly a Royal Commission, about some of the funds that are paid to contractors. It's not easy because in a health system, if you, for donkey's years, for many, many years, long before we came into government, when there were more people around in the health system, more staff, it was still necessary from time to time to have staff come in from agencies and so on, and they tend to charge far more, doctors, nurses, than being able to have full-time staff. And there's an inherent unfairness, anomaly in that, in the sense that you can have full-time staff that are earning a third of what some of these other people are doing. But when there's no alternative, that is when local management says, like, don't have a, I visited a hospital in the regions recently where they all thought she was a lovely person, a very good clinical practitioner, a midwife, and the midwife had come from Western Australia and was making a lot more than other midwives in other hospitals. And the staff said to me, well, Minister, we're really happy she's here. But the management said, but Minister, we wish we could get more locals because we're paying an absolute fortune. It's one of the dilemmas that's been going on for probably 3 decades. Now, Madam Secretary, do you want to add anything to that?
No, I guess it would just be useful for specific parts of the workforce that you're referring to. I mean, clearly we do have to bring in locum and agency staff from a clinical perspective. That's has been part of the health system for many years, but generally speaking, we would obviously prefer permanently employed staff. It just depends on workforce maldistribution issues. Mr. Minns may wish to comment on that, but it depends on what you're talking about. Ultimately, we would prefer to have our own staff rather than bringing in labour hire, but it's a very large and complex system. It just depends on what particular area you're interested in. But Phil, did you have anything you want to add?
Well, Phil Minns.
Just to say that it's quite diverse. So if you take e-health or health infrastructure, they would be unable to function without making use of a contractor workforce, because that's how the workforce chooses to engage in their employment. The point's been made about locums that they're actually paid, generally speaking, at a rate higher than those people in situ as permanent staff. There'd be some trades that we'd need fairly infrequently, and so having them on permanent staff would not make good sense. So it'll be quite a varied picture. We do know, for example, I don't have it with me today, but we do track the expenditure on locums, for example. That's something we could make available to you on notice.
That would be great. If you could provide that on notice, that would be really helpful. Minister, I'm interested in, I understand the staff challenges, particularly in the regions. This is something that we've canvassed in.
Not just the regions, actually, Courtney, it's everywhere.
There are challenges getting staff everywhere in our health system.
Right across Australia. Canada, I was in Canada a few weeks ago. Alberta, exactly the same problems. I was talking to some doctors from the UK only a few days ago. They were saying it's the same problem in the UK. It's everywhere.
So, Minister, I'm specifically interested in cleaners who are being treated as contractors. There's been a surge workforce during COVID to increase the cleaning capacity. Some of those would be contractors or through labour hire. Are you offering those specific cleaners permanent employment to continue working? Are you looking at active ways that you can be engaging with these people who are working through labour hire arrangements and making them permanent
Sorry,
employment?
Courtney, no one has actually raised that issue with me, and I talked to the HSU who represent the majority of cleaners. It's never been raised with me, but maybe Mr Minns would have some knowledge on that issue. Mr Minns?
I can't recall it being raised recently. Sometimes the HSU has made representations to us in the past about security and contractors, and the Minister requested that we look at minimising the need for contractors to operate in the security function, and that's been communicated to all the districts and it's being tracked. So, but cleaners not been raised with me recently.
Well, Minister, as you do, I regularly speak to the HSU and I have high regard for their Secretary, Gerard Hayes, and I appreciate the advice that they provide, obviously to you, but also to us. I'm interested to, and I note that our Shadow Minister meets with them frequently as well. I'm interested if you could take on notice whether there are any efforts to identify cleaners who have been used as contractors through the pandemic and engage them as permanent employees.
I will ask because you've asked, and I'm interested to know myself, but I just turned around to us. We have an HSU representative at the back. I just said, do you know anything about it? He just said no. So, I mean, I'll ask. Is that something that's been raised by someone from the HSU? Or
yes, that's exactly right.
Okay, well, the HSU is a big organisation too, and growing very effectively.
Very rapidly.
Growing very rapidly, yeah.
Minister, I wanted to ask you about Foster Public Hospital. This is something
About which, sorry?
Foster Public Hospital. This is one that I think I've asked you about in every estimates that we've appeared since you made that promise during the last election. Obviously, it's my hometown, so I'm very interested in it. In this year's budget, there was $20 million globally for it, but $1 million specifically for this year. I asked the Minister for Regional Health, who's obviously in our house, in the upper during our question time, what that $1 million is for. She could not provide me with an answer. Can you tell me what that $1 million will be spent on this year?
Generally, those amounts of money are on planning issues around building the hospital. And I know there's a lot of work going on behind the scenes. And there have been discussions in Cabinet, and that makes it a bit difficult for me to say very much to you, except it's very much a focus of the government.
So can you tell me whether that money this year is going to be spent on planning or if it's going to be spent on the purchase of land? Perhaps Ms Walk can tell us?
It's principally planning money, as I understand it, but anyway.
Thank you. There is planning underway around Foster Hospital. The district is working on its service planning as well, which will be done in consultation with the Ministry of Health. There have been a number of sites looked at around feasibility of what might be appropriate, depending on what the services are which are to be provided. And so, yes, that money, and I recall from the last estimates, that was in relation to a larger pool of planning money, not just in relation to Foster Hospital, but in relation to some advanced planning on a number of hospitals.
That was the large amount, not just the million, yeah.
Yeah, so there was $20 million. I wanted to ask, sorry, you said that service planning is underway. I mean, we've talked a lot about the clinical services plan, and the Minister provided me helpfully with a copy of that. I just wanted to, so is service planning still underway, or that has been concluded and now you're looking for a site?
Yes, I know. That's a matter that's being discussed in Cabinet at the present time, and therefore I'm not going to make that available. But let's just say we're working flat out on that issue. You'll be pleasantly surprised at some point. Might even invite you to I couldn't guarantee that, but I would. I guarantee the others.
Okay, I'd place on the record I'd look forward to an invitation to any progress at this site. I'm just really trying to get a sense of whether that money is going to be used. How many sites are you currently looking at, Ms Walk?
I'd have to take that on notice. There was a report which had been prepared by a consultant around number of sites which might be appropriate, but again, that will depend on what the services are which are provided in Foster.
So the consultant has concluded his work?
There was an earlier report done, as I understand it, yes.
Yep, okay.
There's been a lot of work done on it, and they're trying to work out effectively, because it's about, I think it's you would know better than me, but it's about 25 minutes, is it, across to Manning? So you've got, give or take the way you drive. And so there's
I'm sure that you would be driving legally if you get there in 25 minutes.
In that case, I'll be a little bit longer. All right.
There in 25
I
minutes.
tend to switch off when I'm driving, but still. I think that they're busy working the clinical services plan on what's there, what's here, which doctors do we have that can provide the services, what's the likelihood, and they're working through all those issues. But there's also, it's developing much faster past that at the moment, so I would be hopeful that there'll be some possibility of real clarity sooner rather than later.
Okay, Minister, I would only just say this. I'm happy to refresh your memory on it. I know that there's lots of projects around the state that you're across. This specific project, it was promised before the last election.
Yeah, no, I know that.
There's still not a site that's been purchased.
There's
The
been a lot of
clinical
work
services plan has been concluded, that is true, and we finally got a copy of that. But that indicated that it would be an urgent care centre staffed by registered nurses.
Yeah, all I can say to you is what I've already said, but I promise you that it's well and truly under the... It's very much a hot issue at the present time, that's all I'll say.
I appreciate that. Can you say whether there will be land purchased in the next 12 months using this budget?
As I said, I can't say much more at the present time, but the government is absolutely committed to getting the new Foster Hospital underway, and that involves not just the clinical services plan, the consultants' reports that have been done, working with the local health district as to what services, then looking at the sites that are available. That's obviously been undertaken. It's just a matter of finalising some of those aspects.
Minister, can you confirm that parking at the new Tweed Hospital will definitely be free?
I was asked that numerous times when I was when I visited the hospital. I can tell you that the new Tweed Hospital is fantastic. It's unbelievable, more than nearly $700 million worth, but there are still under review the strategies around parking that applies across the broader hospital system, and certainly I know it's an issue for the local community, and I'm working through those issues.
Okay, so but are you looking at a private contractor running the parking, or is it going to be run by the hospital?
Usually these days it's run through a private contractor, but all those issues are being considered at the present time.
So there's an active consideration about how the parking is going to be run.
There's a lot of consideration going on about that, yeah. Sure.
Okay, and so you can't then rule out that people will have to pay if they are parking at Tweed Hospital then, if
All
a
I'm
private
saying
company...
is it's under active consideration as to how we provide not only the parking but the ongoing maintenance of the parking without actually detracting from the money that goes into the local health district. That's always the balancing act, Courtney. If I spend $2 or $3 or $4 million a year of taxpayers' money running a car park, that's $2 or $3 or $4 million out of our budget that might be providing something else. So it's a big issue in every single hospital, and it has to be looked in the context of the local area. So I can't give you that any more specificity than that at the present time.
That's right. Minister, I want to move on to something else because we've got limited time this afternoon. How many hospitals in New South Wales are run by community health units within local health districts?
I'm sorry, ask that a question again.
How many hospitals in New South Wales are run by community health units within local health districts?
I don't think any hospitals are, but I mean, maybe I've missed something in the last 6 years. Can any of the senior staff here tell me what the answer to that question is?
So
I don't understand the question.
I'm
sorry.
told that Tomaree Community Hospital, which has an emergency department and 14 inpatient
In
beds.
Kate's electorate.
That's right, in
Yeah.
Port Stephens, is actually run and managed by the Community and Aged Care Services rather than the usual hospital network within the Hunter New England Health District.
I'll have to take that on notice about that. I know Kate's expressed some concerns to me about aspects of that, but obviously some of these services are very large Health One facilities, and there are a variety of primary care as well as other care in there, as you'd expect in the community. It goes back to what I was saying to the chair before. Everybody liked a level 6 hospital everywhere, but let me take it on notice. And I'll
Okay,
find
if
out
you
later.
can then provide us also on notice a list of hospitals run by Community Health.
I don't think anybody here knows what that means because they aren't run by community health. There might be an organisation or something, but
So I'm told that it actually has very significant implications for the way that hospital policies and procedures act in practice. So, for example, that the government's Clinical Excellence Commission, which published new guidelines on the morbidity and mortality meetings in 2020, that these meetings, the government's own guidelines say that they're critical, but then these meetings aren't held.
sorry, what's critical?
Morbidity and mortality meetings. That they're not held.
I'll take it on notice, Courtney. Don't know.
Okay.
And I'll privately talk to Kate about it too because I actually don't know what presumably she's giving you that question and I'm not sure what it actually means, but I'll talk to her
Yep, she's
about
raised this issue with us. She wants us to raise it with you. It's obviously been raised with her in her local community, and she's an advocate for her community.
She's a very
And she's
strong advocate
concerned
for her
about
local community, and she's
specifically.
spoken to me many times about many issues and she's raised Tomaree with me. So let me talk to that's never been raised about, well, I don't think it's been raised and I have the highest regard and respect for her. So I will certainly try and find out as soon as I can.
Okay, we might ask some more questions on notice specifically on this issue, but it relates as well to the way that if for example, if a patient presents to Tomaree Hospital with indications they've suffered a stroke, and the clinical staff then can't connect to John Hunter Hospital for clinical advice.
Let's find out. I mean, I'd have to talk to the local health district chief executive and find out what the particular arrangements are. I'm surprised Kate hasn't talked to him about that. I think she normally does, but I'll find out too.
Yeah, and I acknowledge that we've had him at previous budget estimates hearings, but I'm asking these questions because Kate's raised those issues, and they've obviously been raised, and they've got implications for the health
I mean, if there are implications as Kate's suggesting, then I'd like to know about it too. So certainly be asking questions of them.
And just for the purposes of Hansard, that is Kate with a K, Kate Washington, for everything that you're doing from this with Kate. It's not me with a C, thanks.
Yes, to be clear, we're talking about
Kate,
Kate
they never said
Washington.
Kate Washington.
I thought it was you.
Kate Washington, the member for Port Stephens.
Thank you.
Thank you very much. I've only got just a few minutes left in this block, so I'm just going to quickly ask you, Minister. I know that there's been work that's been done around cosmetic surgeons at a federal level, and that's being done in consultation with the states. I'm interested to know if there's any work that we're doing in New South Wales around the regulation of other beauty procedures or the licensing. Now, I understand the licensing would be fair trading, but there are also health implications for beauticians or for those offering those kinds of services that can be quite invasive procedures.
Well, look, I can tell you that as late as 3 weeks ago, again at the federal, with Mark Butler's oversight, the state ministers are all talking about the cosmetic issue. I raised this first going back nearly 5 years ago, and it's taken a little while. The federal government, I think now the new federal government is taking it very seriously and are working very hard. It's not a simple situation to just say don't use the word surgeon. It's being looked at in terms of what services people should or shouldn't be able to provide. The federal government with the states will agree on that because it should be across borders. As to the other issues, that has been peripherally raised, and again, it needs to be done on across the Australia basis. You can't have people on one side of the border on the Tweed or one side of the border down at Albury-Wodonga being able to do certain things and the others not. So it's still going to be done through the federal sphere.
I think, Dr. Chan, did you have anything to add on that? You were sort of nodding or...
No, I was just going to reflect that there are some, obviously, regulations that apply in those sort of areas, not specific to your question, but for instance, there's the Poisons Act, and obviously the state has a regulatory function in relation to the Poisons Act. There's also the Skin Penetration Act, and when it touches on any health professionals, then obviously they've got due responsibilities under their registration and credentialing standards for appropriate note taking and taking due conscious, and that goes through the APRA regulatory system. So just as a complementary component.
Yeah, but I mean, beauticians as a whole aren't required to be licensed in New South Wales under fair trading, so they wouldn't have those same kind of requirements. And obviously, they're using increasingly volatile chemicals. They're doing increasingly kinds of invasive procedures. I'm wondering more to you, Minister, whether you're looking at doing any kind of work in that kind of space to say this is an area that we could be having a bit more regulation,
But I
and we could be
think
taking
I've
a
answered
careful
that
look at.
question. I mean, the good Dr. Chant likes to nod at various stages, but this has to be done at a federal level. We have certain powers under certain state legislation, but it still needs to be harmonious across the jurisdictions.
Okay, well, we'll have a break and let's return at 5 minutes past 3. Everyone's here, but sufficient number, so thank you very much. Thank you. Returning to our hearing this afternoon. We now move to the crossbench. Honourable Mark Latham.
Yeah, thank you, Chair. Could I just raise the Minister and also Dr Chant, the Queensland trial that's utilising the services of pharmacists, things like urinary tract infections, drug dispensing without a prescription necessarily for people who've been on the same set of drugs for a long, long period of time, to try and take the pressure off emergency departments. The other Health Minister, the Honourable Bronnie Taylor, spoke very positively about this trial in Queensland at the Pharmacy Guild function here last week. Is this something we're going to try in New South Wales with the critical issue of easing pressure on the EDs?
Actually, I got to say, the Pharmacy Guild, the Pharmacy Society were amazing during COVID when we simply needed all hands on deck to be able to provide vaccinations, COVID vaccines that you were inquiring about before, and they were absolutely necessary. I remember actually asking New South Wales Health whether we could have a look at where the GPs were located across the state, and when we looked at the mapping, obviously there are substantial areas where there are either no GPs or very few GPs. And then I asked for mapping to be done about where the pharmacies were, and the pharmacies had a broader reach. So off the back of that, that was what eventually led to the pharmacists doing so much. They've been amazing. Both of the society and the guild, I think quite properly, have raised that they've got the runs on the board. They've shown what they could do, and as a result, there are further vaccinations that are being permitted to the pharmacies across the state, pharmacists across the state. The one area that I think there is a bit of contention about is what's still concerns, I think, the AMA and perhaps others, is an area which is very problematic, and that is, for example, treatment medications for UTIs and or urinary tract infections. And I've asked Dr Chant what her views are. At the present time, I think we've almost settled on a large-scale pilot across New South Wales to be able to enable her and the senior health team to be satisfied as to that. But I'll ask Dr Chant to update me because we haven't discussed it in the last few days. So maybe Dr Chant could meander through what discussions we've had and where we're at.
So just to update you, there's been ongoing work across with the GPs and the pharmacists on exploring the scope of practice, and there's been a number of pilot initiations of a few different programs. As the Minister indicated, we're looking at increasing the range of vaccines that pharmacists can do, and that's in the final process. And that will mean that there's vaccines such as hepatitis A, typhoid, hepatitis B, to add to the previously approved extensions in HPV and DTPA that pharmacists were able to do. We're also looking at making available a broader group of NPI and NPA vaccines under the National Immunisation Program for influenza as well in the coming year. So in terms of the other points that you raised in relation to UTIs, we've currently been doing significant investigation, including liaison with Queensland and reviewing the international evidence, and we are proposing to, as the Minister had said, doing a trial where we trial pilot that look and making sure we capture robust outcome data to inform that future scope and role of.
Where will that pilot be located?
We're talking, I think the Minister had said broad scale.
Mr Latham, I had said that I wanted it the broadest possible scale, so right across the state. And I think Dr Chant's considering those issues, but I've expressed my views, and Dr. Chan,
So it'll
as a
go beyond
professional, has to work through
vaccines
that.
to UTIs. And,
Sorry, I just missed that. What was it?
It'll go beyond expanding the vaccines to things like asking questions to see if someone's got a UTI.
But that's what I was saying. That's,
Yeah.
I just said that.
That's all
at the
part of
outset
it,
before
yeah.
Dr. Chan took over that.
And
UTIs are one of the biggest issues because people who get UTIs often have it repetitively. The GP's view, of course, and I understand it, and I'm respectful of and understanding of their position, is that they would like to be able to look at the broader clinical context of the individual and understand what might be going on beyond that one issue. But also, the reality is that in many areas, people know what they've got. They've had it many times, and it could be done, I think, in a more efficient way for the individual. It can be extremely painful for someone who has a UTI, and they know when they've got a UTI. They know it. So Dr. Chant and I have been having deep, meaningful discussions about these matters, and she's decided with the expertise she has to do a pilot, and I've asked for it to be
That's
very
great.
broad scale.
That's great, because the response to the ED blockages, pressure points, has always been historically to establish co-locate GP clinics. And, I think you've announced, or the Premier announced 25 of them.
They're not necessarily co-located, they're urgent care centres, but anyway, sorry.
But that's historically been the response, whereas it seems that at the other end of the scale, the pharmacies can do more to transfer people or take the pressure off with people who haven't got a clinical need to sit in the EDs for hour on end. And
the challenge is to know where
some do it as a matter of habit, but the pharmacies have got the trust and the connections already to be dealing with those people in the areas that we've mentioned. And Dr. Chant, are you persuaded by the Ernst & Young research admittedly conducted for the Pharmacy Guild that this is an initiative that would save 17,000 hours of emergency services?
I think in terms of the fact that we've been reviewing the evidence internationally, and it's very important to draw on that international experience as well as the experience in Queensland. We've provided that advice, but it covers the fact that some of the evidence can't be directly relatable to the Australian context because there's different organisations of pharmacists within the primary care structures in different countries. And each of the different countries have set up those roles and responsibilities differently. For instance, in some initiatives overseas, they maintain the separation of prescribing from dispensing by having two pharmacists involved in the care pathway. So we are working through a number of those complexities, and I think you'd expect us to do so to manage and put in appropriate patient safety. We are looking at engaging academic partners to research, to undertake this pilot, to actually make sure the evaluation is well conducted. In relation to the immunisation issues, just to let you know that will just be an immediate on-scale access, and I think that we would all appreciate the great role that pharmacists played in rolling out the COVID vaccines, the great role they play in doing the influenza vaccines, and also that the expansion of vaccines under appropriate referral pathways back to general practice will be, further support the sustainability of the vaccination program for pharmacists.
Okay, thank you. Dr. Chant, can I just take you to a separate issue? You weren't here at the last estimates, but I raised the matter of the Adam Marshall COVID infection in this building on the 22nd of June. And I was told repeatedly at the estimates, and again it's on the parliamentary record from Minister Taylor, that Minister Hazzard received this individual assessment, and it was said to be taking into account the physical distance between two people, the amount of time of the contact activities being undertaken at the time where the infectious person was coughing or had other obvious symptoms of COVID-19, and the environment in which the contact occurred. So I was led to believe that this was some sort of sophisticated process. And then, incredibly, after what had supposedly been an exhaustive SO52 process, they produced the Jenny Mustow case assessment of Minister Hazzard. And it won't take me long to read it out because it's scribble on this one page, dated the 24th of June. Min Hazzard, reception in office but not face-to-face, 6:30 p.m, National Public Strangers Dining Room, head of pharmacy, 3 metres past Heffernan David, 20-second speech, then left at 6:50 p.m. and then underline casual. Where's the sophisticated individual assessment according to the things I was told at estimates and what Minister Taylor has put on the parliamentary record?
So I would just say that practitioners take a lot of verbal history and then write down a summarised notes that's commensurate with it. The staff involved in this assessment, particularly Miss Musto, is an experienced communicable disease nurse who I hold in high regard, and I would assume that and assure you that I have no doubt that she followed correct processes in taking an interview, doing the interview. You have been provided with the records, but I would just like to put on record that the staff involved in the assessment would have followed all usual processes in taking relevant facts into account, and that does summarise as per their understanding of how COVID is transmitted, informing their risk assessment and the casual classification. And behind that sits CDNA guidelines, etc., that exist in terms of classifications of close and casual contacts.
But it doesn't even mention Adam Marshall.
As I said, that's her handwritten notes. I don't know the context of that.
Doesn't mention the infected person.
Chair.
Yeah, the time's up. Kate?
My turn.
I can't make any comments. I'm happy to take any comments on notice, and I understand there isn't a parliamentary committee which will further consider the facts, but I just wanted to absolutely stand by the staff involved in the assessment process.
Kate, full 10 minutes.
Thank you. Minister, are hospitals penalised for not meeting key performance indicators, for example, surgery, wait times?
Well, by whom? Sorry. In what sense?
So are hospitals penalised by the LHD, by New South Wales Health, for not meeting certain key performance indicators?
Not to my knowledge, but I'll
Ms.
pass that
Pearce?
to the Secretary.
No, they categorically are not.
Could there be a scenario that a local health district is doing that?
Look, I think it's hard for me to comment on that. I don't want to speculate about that. It would be highly unusual. I have never been advised of any such thing during my years in health, and I think if we were advised of such a thing, we would address it, because that is not, the way we go about our business with respect to KPIs.
Okay, I just wanted to turn to the situation at John Hunter Hospital in Newcastle then. So there has been reports of, as of today, that's the 27th, that there has been a poll of 250 of the hospital's kind of surgeons and doctors were invited to respond to this poll. 169 of them voted, as I understand, which is a pretty good turnout. So this poll found that 82% of them had been directed to alter the clinical urgency of patients on waiting lists. And they've said that this is this kind of routine, they call it routine recategorisation of patients to avoid breaching surgery wait times. So you're aware of this?
I've read the article, yes.
And what's your response?
Look, we have a policy with regard to the categorisation of surgery patients, as you'd expect. I've spoken to the Chief Executive in regard to that report and the issue that is being raised. We, at the request of the Chief Executive, will be assisting with a compliance check in regard to our policy and how that's enacted at the John Hunter, and he's asked the Ministry to do that so that it can be at arm's length, and we will in turn hire an independent team to do that. There is the ability, of course, under the policy for patients to be recategorised for a variety of reasons. So it might be, for example, that the surgeon's unavailable, the patient's not ready. It could be, for any number. They might become more urgent. And our system operates to be able to allow some flexibility. The policy clearly requires that the clinician is required to be involved in any reclassification of a patient, and that's important because, clearly the clinician needs to make those decisions in the best interests of patients. In respect of the commentary in that article, which I have read, that there is this notion that the hospital somehow is financially penalised as a consequence of KPIs is categorically incorrect from a New South Wales Health perspective. So, look, we are looking at it with the Chief Executive. He has advised me that up until the point that, and he's obviously spoken to his management team in the hospital in regard to it, including the DMS and the General Manager, the Director of Medical Services, sorry, so that, he can reassure himself from their perspective. He's been told by his team there that, that they are certainly not aware of this issue in the way that it's being described, and we will, work with them to have a look at it.
Thank you. That was good to get that response, and it's also good to hear that there is some independence in terms of the inquiry into that. Were you also aware the same poll asked whether the respondents, so the surgeons, anaesthetists, obstetricians and gynaecologists, whether they had confidence in the current leadership of the health service? 93% of those 169 respondents said no. Is that also going to be a part of the inquiry or investigation that is undertaken into why there is such a lack of confidence in the leadership of John Hunter Hospital?
Look, just to reset the language, I think compliance checking against the policy is what I've described in regard to the surgery classification. There is a meeting scheduled, and I have spoken to the board chair of the Hunter New England Local Health District, who will meet with the representatives of the group to really understand what their concerns are so that we can address them. The chair of the Medical Staff Council, I think, was also quoted last week or maybe earlier this week in regard to the Medical Staff Council's attitude towards the management team there, and they didn't necessarily share the same view. We will also and have also assisted the Chief Executive and the Board Chair by asking Professor Mick Reid, who is very experienced in the health system, to attend that meeting with the Board Chair, with the doctors. So
That's going to be my
once
next
again,
question.
there's an opportunity to fully understand what the concerns may be. Can I say our chief executives have very challenging roles. I have no reason to believe that Mr. Di Rienzo is not executing his role in any other way than to support his hospital and do the best with the funding that he receives. And we will continue to work with him to address these issues.
Thank you. Thank you, because it is in the article and the poll, I think there is a blur as to whether people are talking about the LHD or the hospital in terms of the
problem
leadership.
with that inquiry. And can I just say,
I have 3
part of the
minutes. I
problem-
do have 3 minutes,
Can I
Minister.
just say
And
this
it's my
very
last
quickly? I don't
time
think
for questions. And I really wanted to get to another issue. Sorry about that. My last 3 minutes with you, Minister Hazzard.
Last 3 minutes.
My last 3 minutes with you.
we've got
So I
another
did
block at
just
the end.
want to.
that,
I'm
is
not
it
sure
that
we do.
special, Kate? I mean,
But
that's really good. Thank you.
I wanted to turn to a completely different issue, which is vaping, particularly amongst people under 18, vaping generally. There was a report today in The Guardian that Victorian Quitline, they undertook a survey, a history of who were contacting them for help. Teenagers as young as 13, you can say that the same will be happening in New South Wales. I'm suggesting that unprecedented in 30-year history of Quitline in Victoria, how many young people are phoning needing help. A 13-year-old called to say vaping was endemic at her school. One mother contacted the service saying she was concerned that after she confiscated vapes from a child, they began experiencing withdrawals and chest pains and arm pains, on and on and on. Firstly, is New South Wales Health doing about this, and has there been any approaches around what a regulatory environment for vaping in New South Wales would look like?
There's a
Nicotine,
nicotine.
nicotine.
Well,
obviously.
vaping's very hard to stop, obviously, but there's an education program going on. But can I say to you that under the prior federal Liberal national government, I raised this issue. I was the one who actually specifically raised it. And then I raised it again with the new Labor government in the very first Health Ministers meeting. And to their credit, they are very aware of the issues. There's actually a review going on at the moment as to how we can best handle it nationally, because it is not just a case of a state or territory being able to do it by themselves. They can't, because these vaping things are often coming in from overseas. And I remember going back maybe 6 years ago, Kate, announcing publicly, and it was in the media at the time, that people should be really cautious about vaping, because as one of the researchers from the Woolcock Centre said to me, basically what you're doing is you're vaping antifreeze with 500 different flavours. And I've been on this now for 5 years. The federal government, under the former government, found it a bit challenging, but the new government is saying that they're with us, and all the state and territory Labor ministers and the one remaining Liberal minister in the Tassie, we're all concerned about it. It's terrible. What we've seen
With
is a mass...
this in terms of, can I is this to move to a regulatory environment so that, you know, it's in some ways regulated,
All right,
people
Kerry
under
Chan
18?
wants to say something.
Thank
So-
you, Dr.
So
Chan.
just to be clear, that the current regulatory situation is that vapes that contain nicotine are illegal.
That's right.
The only way you can obtain e-vaping products containing nicotine is through a prescription prescribed by a doctor as part of a therapeutic risk minimisation program for smoking cessation. In terms of the regulatory activity, New South Wales Health has been doing a lot of regulatory activity in seizing vapes. I've personally written to companies highlighting that it is my view that I would be expecting that a responsible person selling vapes, given that 50% of the vapes we've been seizing when we go out and do random samples, such a high proportion of those vaping products actually contain nicotine, that I'm actually asking people that are stocking these products to actually do their own independent verification and not rely on what they've been provided with went through the importation process. We've also been highlighting this issue with the Commonwealth, and we appreciate the issues and the support from the Commonwealth in terms of the border. We have also launched, and the Minister launched in March this year, New South Wales education to do you know what you're vaping, which highlights the products it contains, and a number of other jurisdictions have had interest in that, and some of them have taken that up, and we're proposing to do further work. This is a significant public health issue, and the Minister has had extensive discussions with options and regulatory aspects. But I just would like to say that I would be calling upon all the people that are stocking these products to also be aware that when we go out and do random samples or checks, that we are finding still a lot of nicotine in these products. And so they are being seized, but I just would like to put retailers on notice.
Thank you. Now to the opposition's opportunity to ask questions. Minister, I'd like to return to a matter I raised at the last hearing, budget estimates hearing, and that is the matter of the treatment of children and young people who may be or are gender dysphoric. Now, I've got 4 folders of material, which I'm not going to take you through. There's a copy for yourself, a copy for Dr. Chant, a copy for Ms. Pearce, and if you could please pass on a copy to Dr. Murray Wright in regards to the same material. Minister, you are aware we obviously covered this at the last hearing. You took the range of matters I raised on question on notice. You would be aware, and you came back with a relatively short answer of 4 paragraphs, which I presume, and if I'm incorrect, please tell me, on advice was prepared by New South Wales Health to assist you answer the question. I just want to make one particular comment that you may or may not be aware, but in terms of the final paragraph, and I'll just read out, this is your answer to question on notice. You say the service, and this is the Trans and Gender Diverse Health Service, strictly operates under international and national endorsed guidance including the World Professional Association of Transgender Health. And there's the link to their guidelines, or that organisation, and the Australian Standard of Care and Treatment Guidelines for Trans and Gender Diverse Children and Adolescents, and the link to that. Can I just draw to your attention, I'm just putting this on notice for you to take away and have a think about, that with respect to, and inform yourself about, that with respect to the World Professional Association for Transgender Health, that organisation is effectively made up of a membership base that are fully committed to the affirmation approach with respect to the treatment of people who may be or are gender dysphoric, including children. And taking you to the second reference you give, which is the Australian Standards of Care and Treatment Guidelines for Trans and Gender Diverse Children and Adolescents, with respect to those so-called Australian standards, they aren't Australian standards. What they are is a set of guidelines that have been produced by the Royal Children's Hospital Melbourne Gender Clinic. And cleverly, from their point of view, and I think it was a bit smart by half, putting the word Australian in front of it to give it the sense that these are national guidelines that have some formally endorsed approval. So I just draw those two particular points to your attention. In the bundle of documents, because there seemed to be some unawareness of this in terms of your response, is the CAS review document, which is the comprehensive review that was undertaken by Professor Cass in the United Kingdom, which reviewed the treatment of children and young people who may be or are gender dysphoric, leading to the closure, I repeat, the closure of the Tavistock Institute in the United Kingdom. Thirdly, can I take you to, and this is a further development in the United Kingdom only announced in the last 3 to 4 days, and that is what is a new set of what are interim service specifications produced by the National Health Service England in regards to the matter of children and adolescents who may be or are gender dysphoric. And what you will note, Minister, and the officers that I've provided a copy to, is that they are further moving away quite strongly from the affirmation orthodoxy that has been applied hitherto, which is being used, I submit, in New South Wales, and I specifically cited the Maple Leaf House in Hamilton East, and the John Hunter Children's Hospital. And this is a further example of international jurisdictions at the very highest level belling the cat about how the orthodoxy of the affirmation approach with respect to children and young people is potentially very serious, and with its negative consequences for the long-term health and well-being of children and young people as they grow into adulthood. And the last document I want to draw to your attention is a document that actually is produced by the National Association. This is the Australian National Association of Practising Psychiatrists, and what it's titled is Managing Gender Dysphoria in Young People, and it's the National Association of Practising Psychiatrists Guide. And what you'll find, Minister, is that this document, which is fully referenced and at the back containing what are the co-signatures of the key people involved in its development, are very clearly making the case that the affirmation approach is having profoundly negative consequences on a number of children and young people. And I cite the examples which are well known of young women at the John Hunter Hospital, still in their teenage years, and I'm meaning 18 and 19 and up to 20, having double mastectomies, and surgeons conducting that surgery of double mastectomies of perfectly healthy tissue from young girls, young women at that hospital. So I draw that all to your attention. I have to say, I found your response in regards to the answer to the question noticed completely inadequate, because what it failed to do is address the issues that I raised in what was quite a long run-up in explaining matters, because it didn't appear to me and that was confirmed by your response and indeed the health officials at the table, that they didn't seem to have some clarity around these matters. But I urge you to look at this and once again give this serious consideration. There are young people being very seriously damaged by the application of the affirmation approach to the treatment of children and young people who may be or are gender dysphoric in New South Wales.
I'll take that on notice as being
Thanks.
your concerns. I will certainly read it.
Thank you.
But as I understand it, and I'll just place on record that I don't believe, but I might be wrong, are you expressing views on behalf of the Labor Party?
Myself.
Or are you expressing your own
As a member of the
views?
committee.
So expressing your own individual views is
No, not my own views.
expressing views on behalf of the Labor Party.
No. I'm asking a series of questions now for the second time directed to you as a member of this committee.
But I'm asking you, are you expressing, you're expressing a view, you basically, and I accept that people are entitled to the view, I'm just asking, is it a view that is a Labor Party, a position, or is it Mr Chair's
I'm going
personal
to take a
view?
point of order there, Chair, because the Minister
been through
is
this before.
entitled to answer questions today. He's not entitled to ask questions himself. And I think you've made it
So
clear
you
that
think
you're
it's a Labor
asking-
Party policy too?
No, Minister, listen, we
Minister?
know, we went
Or
through
is
the
it or
very...
isn't it?
No, can I just say this? We went through the very same question from you to me at the last hearing, and I gave an answer, and I direct you to that answer. It's exactly the same question, and I direct you to
Well,
that
I'm
answer.
directing you to the answers that I've already given, so it's exactly the same. There you go.
Oh, well, if that's all you've got
Look,
to say...
I'll tell you what.
If that's all you've got to say on a very serious
I will say
matter-
this. I will say this.
If
I
that's
think,
all you've got to say on a very serious matter...
Oh, no.
that I find very, very disturbing.
What I would say
Very,
to you,
very
Mr Chair, is
disturbing,
I don't
Minister.
believe it's Labor Party policy. I think the issues around children's sexuality is very, very complex. I'm very aware of the Cass report. I'm very aware that after the Cass report came out in, I think, March, there was a series of other reports that also came out challenging the findings of the Cass report. I'm very aware of that. But I'm also aware that I, for one, am not going to engage in public dissertation, particularly in this environment, where I might cause any concerns to families or individuals, youngsters or otherwise, who are going through the most complex of circumstances. But I will read the material. As a courtesy to you, I will read it. But as long as we're clear that I have a high level of sensitivity to these issues, and I want to place on record that my general view is that the Maple Leaf House staff do an extraordinary job in the most complex of circumstances. Very multiple disciplinary, world-class team. And there is a similar service in the western suburbs of Sydney. I think we are all concerned, we must be all concerned that children have these complexities. Perhaps it's always been there. Perhaps we don't know the full details of it. We know that there are a lot more kids that need assistance and families. But I'll read the reports, and I'm taking it then, even though the Shadow Minister sitting in the corner has taken a point of order that even so, I'll at this point in my career, on the last estimates, will say I'm going to assume it's not Labor policy because I don't think it is. But that's okay. I understand you have an entitlement as an
Minister,
individual member to
I
raise
just
these
simply make
issues.
the point, this is not a matter of policy. This is a matter of something that's very serious happening on your watch and has been for some years. The issue of these most aggressive surgeries involving, for women, the removal of both breasts, ovaries and uteruses. And with respect to males, the removal of penises and other reconstructive surgery. Now, this has been around for a long time and I've heard nothing from this government about it. Nothing from you as a health minister.
Well, I'll make clear that I absolutely endorse the work of the Maple Leaf House in trying to arrive at the complexities,
Have said
and
that,
I will do everything within my power in the next 140 odd days to make sure that those services are able to do what they need to do with no pejorative views on anything to do with transgender. People who are of LGBTIQI, I find it absolutely appalling that there would be people in this place, in the Parliament of New South Wales, who would still want to actually dig into this in this sort of environment rather than a sensitive, clinical, medical and human environment.
Well, Minister, I'm not going to finish at this.
Here.
I'm not going to finish this because
done.
with that, because Minister,
Knows themselves.
no one can say that Professor Cass, who was a highly esteemed individual in the United Kingdom who wrote that report on the request of the National Health Service, did anything other than produce an extremely high-quality report, which led to the closure of the Tavistock Institute. So if you to dismiss Professor Cash just like that out of hand, I find it an extraordinary thing.
I didn't. What I said was there have been assessments, professional assessments, that have raised concerns about it, and I don't intend to pursue this in this environment. This is not the appropriate environment. I'm sorry, Mr Chair. You can't have this as your personal little tirade or campaign.
No.
It's not what this committee should be about.
You're
and I will not
ignoring-
answer any
you're
more
ignoring-
questions on this issue.
You're ignoring tragedy.
You can do what you...
going on in New
I'm
South
over
Wales.
it, okay? I will not engage with you on this issue.
Yeah, that's the whole problem. You're over it. You've just turned a blind eye to it.
Seriously.
The Honourable Court useless.
Seriously,
very much, Mr. Chair.
your union is wondering why you're still here, and I must say I share that view when I hear these sort of...
Minister, I don't think that that's a fair representation, and I would like to
Courtney,
move
for
on
that.
to another issue, which is Rouse Hill Hospital. In response to questions on notice from the last hearing, you said that the clinical services plan had been finalised by Western Sydney LHD and submitted to the Ministry for...
Sorry, Courtney, I was still somewhat fired up listening to what has just been said.
Rouse
Say that
Hill
again.
Hospital. Rouse Hill Hospital. Questions on notice from the last budget estimates hearing, you said that the clinical services plan had been finalised by the LHD, Western Sydney LHD, and submitted to the Ministry of Health for review. When will it be released to the public?
Before the next election, sooner rather than later. That's
Okay.
all I'm prepared to say at this stage.
And how long ago was it submitted to New South Wales Health for review?
What, sorry?
The clinical services plan?
All right, because I know this.
Does anybody know?
Ms Wilcox can probably answer.
Deborah?
Yeah, the planning work is not completed. We are having discussions with the local health district and finalising it as we speak.
So, but it's been, can you just provide clarity? Because in answers to questions on notice, you said that it had been finalised and submitted.
Yep,
So
sorry.
it's still going on.
We are in discussions with the local health district about the plan. So once the plan comes in, we work with the local health districts to understand what might be the capital requirements, and we also, test their assumptions around what the clinical planning is that they've brought forward. So it's an iterative process between the local health district and the ministry, and we're working through that currently.
So, Ms Wilcox, as it stands at the moment, what is the proposed capacity for the emergency department?
I don't have those figures with me today, but I'm happy to take that question.
But also that information is information which is currently subject to the government's consideration in the Cabinet, and there will be announcements made on that in due course.
Okay, I accept that, Minister, but there's a document that's been produced to the Ministry of Health. Obviously, it's working off a particular assumption.
It's not finalised, so it's not of any great moment, and as I said, there'll be announcements made in due course.
Okay, and you're anticipating that the clinical services... Can you commit to releasing the clinical services plan before the election?
The clinical services plan is very rarely released, actually, for a variety of reasons, because people actually have to be able to speak in with confidence about the various clinicians. Right? They give their contribution to that. But what will be released is the master planning, the hospital, and that will certainly be done in terms of... I don't know whether you've forgotten, but I'll just say this. You remember that there was on one side of that big intersection there, right near Rouse Hill Shopping Centre, and then there was a problem with that which had something to do with roads and transporting, wasn't it? Yep. And so then they had to go about trying to find another spot. So they now got it diametrically, is that right? Diagonally across the road. They've got the site, and they're trying to make sure as to what services work, and of course it's part of the network again that goes on between...
I understand, and we've talked about networks before. I have limited time, so I wanted to ask you if they'll have maternity services, obstetrics, paediatrics, oncology services.
Those
What's going to be provided?
will be made in due course.
Okay, but you can't tell us today how many
Those
operating
announcements will be
theatres
made.
are going to be available.
Seriously, building hospitals is worse than actually building an aircraft carrier. It's complex, and as Ms Wilcox has just said, they are working through those issues with the local health district, and that means they'll be talking to them about not only what services should be and what extent of them should be on this particular hospital, but how that will relate to the other hospitals that are in the area. Are there enough specialists in the area that might or might not be there? There's a whole lot of issues. But I assure you that the intent is to have that announced as soon as possible.
Okay. Minister, Wollongong Emergency Department is under enormous pressure, even compared to similar hospitals across New South Wales. Can you explain why there was a 49.4% increase in patients leaving without completing treatment from the latest BHI data?
Wollongong Hospital, particularly when that last BHI was off the COVID or Omicron period, and it was pretty terrible. But as has been publicly discussed in the media and with the federal government. There have been more than 20 aged care facilities closed in that area, and as a result, out of that hospital has 550 beds. It has 375 that are accessible through the ED, and of that, until fairly recent, and I'm not sure what the figure is right today, but as my recent recollection was, there was 100 of the 375 beds blocked by aged care and people of aged care who've gone beyond their clinical treatment and people with disabilities. So as you can see, almost a third of the entire hospital was actually filled with people that should have been in other locations for their own good and should have been cared for by the federal government. Now, I'm not picking on the federal government because I think it's a breath of fresh air at the moment that we're actually talking to people in the federal government and Federal Minister Butler and the federal disability ministers trying very hard, but that's part and parcel. You heard earlier.
So are you looking at? Are you relying on the federal government expanding aged care? Are you looking to expand the capacity? What's the
Well, there's 100 beds there that should be enough,
I
but until the
appreciate that.
federal government can sort that out. And one of the other problems that Mark Butler's got now.
We won't be using our 15.
Sorry? That Mark Butler's got now is just trying to get new aged care facilities in that area and fund them. It's a huge challenge.
That's led to an increase.
Sorry, you're
waiting
speaking
time.
very quietly.
The median wait time for patients to be admitted to the ED has now increased by over 2 hours to an incredible 10 hours. Surely there has to be an intermediate solution other than just...
Health are working on all of those issues and trying to address them, but they're doing it in the construct of when is the federal government going to move these people out. But yeah, it's a huge problem. But it goes back to what we were talking about before. It's also a lack of GP availability. I mean, your colleague Jenny Atchison in her area at Maitland, as she informed me the other day, has 8 weeks before you can get in to see a GP. So that influences the number of people going into EDs at Maitland and John Hunter. Same issue down there, lack of GPs.
Minister,
sure the
we talked
Shadow
about that
Minister would
earlier.
have-
I just wanted to finally put to you, the Minister for Western Sydney has said that Western Sydney has never had it so good. Do you agree with him, given the latest BHI data that showed that 3 out of 4 patients in the highest category in emergency did not have their treatment start on time?
Westmead.
I was going to say $1 billion and a bit for Westmead, $750 million or close to it for Liverpool.
I'm not asking you for that. I'm asking if
1.3
you
billion
agree with
for
your colleague.
1.3. I'm answering the question the way I want to answer it. 1.3 billion for Nepean, and $750 million for Liverpool. All I can say is Labor didn't do it. The Liberals are doing it. And I tell you what, if you guys get in, I reckon you'll cut them out and say, that's it, we're not doing it, because you'll prioritise other things that you've got, because you don't know how to run money, manage money. You never have.
I'm not asking you.
and that's
I'm
the
asking
truth.
you if you agree with your
I've
colleague.
answered the question.
Do you agree with your
I've
colleague?
answered the question.
Western Sydney has never
I've
had
answered
it
the
so
question.
good. Over 30 emergency nurses have left Blacktown Hospital since December 2021.
There's the money in Blacktown too.
In recent months, on a Monday night, the staffing was at -8 inside the ED. For 2 hours on the same night, nurse staffing was -12. There were 55 patients in the waiting room, and there was 1 registered
It's
nurse
like
on
pluck a
triage.
duck. You're just
Are you
picking out
really-
nights, days. I mean, seriously, the hospitals are getting more staff. They've had more staff. We've got more hospitals by a long shot than was ever there under Labor. We've got 160,000 staff. We've got more than another 25,000 nurses, or approximately that, under our watch. We are doing everything we can. You guys did zilch.
That is just not true,
squat.
Minister. That is
Diddly
just
squat.
not true.
And we have
You were
been doing what we needed to do.
That
Diddly
is
squat was
not.
the contribution of state Labor to New South Wales Health.
Yeah. Way to end it on the high.
People have never had it so good. I think that's the answer. Mark Latham.
Thank you, Chair. Dr. Chant, just to draw your attention to these documents, Dr. Michael Douglas, who I'm sure you respect, retrospectively furnished this report for the SO52 about the contact with Minister Marshall. And it reported that Minister Marshall, quote, had very close contact to Minister Hazzard and had a conversation before he spoke. It was at the National Party dinner on the 22nd of June last year. And then in the material headed the Ops Trello cards, which seems to be drawn from contact traces, it said early on the morning of the 24th of June, no contact with the Premier or Treasurer. Marshall seems to have had direct contact with the Health Minister at the charity event. How can it be that the Musto case notes don't even mention Adam Marshall, and these instances are very close, in one instance physical contact with the Minister?
I can't comment on those documents in terms of all I can say is that the process of the interview would have been conducted with Minister Hazzard in accordance with the usual processes that would have been undertaken by the contact tracers, and I understand those matters are being dealt with in a parliamentary inquiry, but I have no reason to believe that other than that the staffs would have approached things in the consistent with the assessment processes that were outlined.
Yeah, the Minister himself at any stage inform you as to why he himself isolated for 24 hours after he came into the function, shook hands with Adam Marshall, had a conversation
Everybody
with
did.
David Heffernan and
Everybody
Richard
did. You might have forgotten, Mark. Everybody did. Everybody who was in the parliament, basically. And Labor, Liberal, I don't know where you were, but let me tell you that this obsession of yours is just getting a little bit too far. If you want me to read out Adam Marshall's tweets or text to me after you sent out a defamatory tweet, which you'll hear about in due course, Adam Marshall gave me very clear on the text that he had advised the journalists who followed up on your stupid tweet that he did not shake hands with me. So, you know what? Wait for your inquiry and wait for the letter from the defamation lawyer. On that note, there'll be no more answers on that.
We'll certainly wait for Adam Marshall to tell me at the inquiry the things that he's also told me.
Mate, I've got it here, and
you want the full.
I tell you what, there should be an inquiry into. There should be an inquiry into you.
You want the
You know
full
what the
cast from
definition of a
Adam
man
Marshall?
is? Someone who doesn't pick on the vulnerable and carry on with obsessions. Go back to anyway.
Order.
This is about
Seriously,
your behaviour.
You are absolutely,
And
you are
can bluster as much
absolutely
as
the
you
most
like.
inappropriate human
Doesn't
being to be in
avoid
a New
what
South
happened.
Wales
Yeah,
Parliament.
we've heard all this.
Order.
You know,
Order.
you couldn't get yourself a position in the
Order.
federal Parliament, so you got yourself
Order,
down.
Minister. Order.
Three
Order,
different
Minister.
political parties. A man of principle.
Minister.
Good Lord.
Minister.
It just
Sorry.
exposes
Bit of
your
self-control,
guilt for
please.
walking your own rules. Now, Dr. Chant, to take you to the sequence, early on the morning of 24th.
Wait for your inquiry. Go away.
We've got the contact tracers reporting that Marshall's had direct contact with the Health Minister at the charity event. By the end of the day, they're saying, Kerry, I assume that's you, wants all Parliament-related lists done finalised AM or as close as possible. That's at 11:10 p.m. on the 24th. So something happened on the 24th whereby Musto was allocated to do this
Dr. Musto to you.
individual assessment.
Dr. Musto.
Order.
Hazzard.
Dr. Musto.
Did you appoint Jenny Musto or ask her to do the
Dr.
assessment?
Musto.
All I can talk about is the usual process whereby I would delegate when matters have happened in relation to a variety of needs to do assessments. That would be allocated to staff either within the ministry or within our public health unit network, and that is appropriate. So if there are issues where the staff would have just been following normal processes for contact tracing.
Well, the normal process seemed to be Jenny Heads doing the assessment of Speakman, Correa, Catley, Barr, and the list goes on of MPs. Who appointed Jenny Musto to do the assessment of the minister?
I can't recall the exact processes of it or don't have that information, but there is a variety of teams. I don't even know who was on duty at the time, but there were a number of key staff, and it is appropriate that a variety of different staff would have been involved in various aspects of it. In terms of Michael Douglas was overseeing the whole process in relation to the contact tracing, and as I said, I have no information that's been presented to me that otherwise a very straightforward process and an appropriate process was followed. Mr. Lathan, I can assure you of the integrity of the two staff members involved.
How many other individual assessments of MPs did Jenny Musto undertake?
I don't have that information.
Ms. Pearce, do you know who appointed or asked Jenny Musto to do the individual assessment that came up in this belated
No, I do not.
No, nobody recalls. Minister, you must have some idea of...
What I have an idea about is you're obsessed and you're quite mad. I have a text here that says, I do not recall Minister Hazzard and I shaking hands, and that is from Adam. Can I point out to you, you are really quite silly. On the 2nd of March, I was the minister who actually first told people not to shake hands. Have a look in the media. I wasn't shaking hands with anybody. I tell you what, I won't be shaking hands with you at any stage.
Well, nobody's asking you to, but you can answer some questions. Why did you isolate for 24 hours?
Because everybody you twit, everybody was told...
Minister, we don't refer to
Well, he
that.
is a twit. Everybody was...
Minister, you know better than that.
Everybody was told to isolate in the first 24 hours. Whoever had any likely, possible, vague, I don't know why, but we were given those directions, and that was a health issue. It was run by the doctors. And then eventually, as they got the time to go through what was a very large group of people in the Parliament that had been put on close contact initially, as they went through them, they then became casual contacts. And apparently that's what happened with me. But you know what? You are just obsessed. You are crazy. You shouldn't be in this Parliament.
Well, Adam Marshall has said you've ordered your own rules, and that's
rubbish.
been confirmed by witnesses.
Rubbish.
David Heffernan was there, Richard Walsh was there, a number of your now cabinet colleagues were at the function, all saw what happened, and say this guy, Brad Hazzard,
You are a twit. You know what?
Now, why can't you
Somebody
just
should
own
have
up
an
to that
inquiry
honestly?
into you, because there's lots of things going on that need to be inquired into
Minister.
Well,
We
you
don't use the word twit.
go for your life, but this is a question to you. Why haven't you been honest in giving an account of what
You
happened?
are a liar.
Walked in
You
at
are
the
a liar.
northern end of the
Order.
function.
You are a liar and an
You,
obsessive.
shook hands with Marshall,
Order.
greeted him, had a conversation.
And no
with
one
him
in
and
this
David
world,
Heffernan.
except your crazy anti-vaxxer friends, thinks you should even be here.
Order.
Got news for you.
Minister,
the quicker you go, the
Minister.
quicker. Yes.
Well, you're the one who's
we're
going.
returning
You're
back
running
to-
from the building because you know you're a rorter. You know.
Okay, order.
what happened that
You're a
night.
I think
complete flip.
I think we're getting.
You're the
pretty
one
cl-
going.
Order.
I'm not going anywhere.
Order.
God help the New South Wales community.
Hang on. Please,
Explain. How do you explain Dr. Douglas?
Oh, point of
Order.
order.
There's been a point of order
order.
taken.
Point of
Marshall
order.
had very
Point of
was
order
very
taken.
close to
There's been a point of order.
Just
The Honourable Mark
disrespecting
Latham.
the chair. All I'm saying is, can we take some heat out of this exchange?
I'd dearly like to do
It's
so.
totally inappropriate for estimates inquiry. We have got an inquiry in the upper house going into this whole issue you want to explore. And I'm not sure that it's productive to be rehearsing the questions here. You're not getting the answers you want. But nonetheless, can we take the heat out of it, Mr. Chair?
I dearly would like to do that, but the reference to people as twits and other names like that
Both directions.
is not helpful.
Well, really,
So-
this question's out of order because it's not in the purview of the
Minister,
estimates.
you don't chair this meeting.
Okay, so you're actually endorsing it.
What I'm saying
you have a
is
good
you
arrangement,
don't
don't you?
you don't
A
share
lot of
this
money
meeting.
was spent locking people in their homes and saying get vaccinated, otherwise you lose your job. And close contact
Rank
rules
and
enforced,
rancorous.
and the police
rank
and
and rancorous
helicopters
was your
over
latest
Western
assessment
Sydney.
review.
They're all expenditures
and
for
rancorous.
rules
I'd
that
add-
you wouldn't follow yourself.
I'd add a lot more than that, and you've heard them. You're rank and rancorous, and seriously, I couldn't be bothered talking to you. Speaker, Mr. Chairman, unless we're going to go on to something that's actually substantive, then this committee should be terminated.
Well, how
at
does
this
the
point.
Minister explain the record of Michael Douglas saying that Minister
way.
Marshall reports very close to Minister Hazzard? I had a conversation before he spoke. How do you explain you ever became a casual contact?
Session.
How do you explain the Ops Trello cards that Marshall didn't have contact with the Premier or Treasurer? Seems to have had direct contact with Health Minister at the charity event. Surely, Minister, you knew you were a close contact. And if you had the decency of following your own rules, you would have isolated for the fortnight period instead of having so many of your colleagues complaining to me that you ordered your own rules.
Order.
Had any
Order.
understanding
I'm into this because
whatsoever
of your
of the
people.
way the health system works. There is no way in the wide world that I would have given any directions on anything. There were assessments made by the doctors, and that's the appropriate course. And you can carry on from here to eternity, but that's the truth. So just drop off.
Can Ms Pearce or Dr Chant take on notice how many other individual assessments Jenny Musto performed on the 24th of June? Because the records seem to indicate there was just one.
I'll undertake to follow up that question, Mr. Lathan, and as I said, the process is that available staff are allocated to do the tasks available on particular times, so I'm
And
happy
can you
to
search
take
the
that.
records as to who allocated Jenny Musto to this particular job, please?
I will do my best to provide the information to the committee.
That's the time. Kay Femin.
Thank you, Chair. And I wasn't my last 3 minutes, so
There
I'm
you go.
back. I just wanted to turn. I just wanted to hand this out, Andrew, if that's yep. So just getting back to the questions that I asked at the beginning of this hearing about the requests by New South Wales Health.
Sorry, Kate, on what?
Yeah, no, I'm explaining it to you now. Sorry, just getting in relation to recurrent funding. So, and my question around it being rejected by Cabinet. So there's two requests here. One is, it says here from 2020 to 2021, this is what I was talking about before. What does NCOS stand for?
So where is NCOS?
Ms Pearce?
Net cost of service.
Yeah, net cost of service, that's right. So $510 million over 10 years. And then
Sorry, Kate, what
you
is
could
this document
see,
you're talking
you
about
can see $2.6 billion over 10 years. So just, Ms Pearce, did New South Wales Health submit this request for funding for those 2 years?
Oh, Ms Fenman, I would need to take that on notice. I mean, our funding requests are complex, obviously with the size of our budget, and I did answer this question, I think, in the ED inquiry, if I remember correctly, but I would need to take on notice what the specific line items were of that request.
Because this says here, and it's I understand it's a part of something that did go to the Minister for funding by New South Wales Health,
Sorry, Kate, what do you think this document is?
that it is part of a document that went to you and Cabinet for funding from
whom?
New South Wales Health. I'm not telling you who.
No, but
I'm not.
The
who in
question
New-
is-
what part of New South Wales Health?
The question is...
I don't recognise this document. I'm just trying to work out.
I'm asking
what
Ms
is it?
Pearce because I think Ms Pearce
didn't
probably has more of an idea of whether there was $2.6 billion requested over 10 years last year, for example. As it says, it talks about the health capital program. This is to support CapEx, if you like. I notice in Health's annual report that... Actually, I question Ms Pearce, do you know whether within New South Wales Health that there was any work undertaken with New South Wales Treasury, or do you work with New South Wales Treasury to come up with a kind of, to be able to determine what operating costs are associated with a capital expenditure budget?
There are multiple processes associated with capital expenditure. Obviously, the size of the facility, the layout of the facility. There are a lot of things that contribute to those calculations. There are financial impact statements that are conducted prior to hospitals being built, which go some way to that. But of course, once the hospital is built and it's operational, we need to assess those things. Of course, we provide advice in regard to our budget through cabinet processes in the lead up to budget announcements. You would expect us to advocate strongly for our health system in doing that. That's what we do. And I think, as I noted at the previous inquiry, we did have a 10% increase in our budget this year, which was in no small part due to the advocacy of the health officials around the table for the health system and also with the government's endorsement of the requirements of the health system, particularly on the back of the pandemic, where all health systems across the country are dealing with increased cost of running health services. It's quite significant. Inflation is contributing to that, of course, but we are, like everywhere else across the country, thinking about how we use our health dollar the best. In respect to this particular document that you've provided and the line items, as I said, there are cabinet processes that go to our budget, but I can't confirm the figures that are in here today.
So is New South Wales Health able to meet its operational demands that you have? If you look at what the projects coming up, say within the next funding envelope, is New South Wales Health able to meet the operational demands as a result of capital expenditure that's happening? Are you able to meet your operational demands within the current funding envelope?
So in this, I can really only speak for this financial year because obviously on a yearly basis we go back and work with government in regard to the health budget increase. And for this year, we did have a sizable increase in our budget, which did reflect the significant impact of the pandemic on the cost of running health services. In addition to, I think we've had something in the order of $1 billion to address, for example, the backlog in surgery. There have been, and Mr. D'Amato will have the exact number, but we have received billions of dollars in additional funding during the course of the pandemic to address those issues.
Yes.
In respect of this financial year, we have, received a 10% increase, and we believe that is.
Is that a 10% increase for the operational costs within New South Wales Health as a result of capital expenditure and dealing with surgery wait times, all of that?
It goes.
Is it fair to say that COVID has potentially impacted on the operational costs budget? Because as I said, I think the 2018-19 funding request was 19-20 funding request was approved, and then the two after that have been rejected. The $510 million and the $2.3 billion have both been rejected. Is it fair to say that COVID's impacted on that, and the operational costs within New South Wales Health aren't being funded like they should be?
We don't even know what you're saying here, Kate.
I think Ms Beers does know.
Well, no, she doesn't.
With
It's
respect,
after.
she's been answering it pretty competently.
But you've just put propositions that there's been money rejected, and what she's saying is the budget is being managed. There's been an extra $1 billion. The budget is very complex, extremely complex. For example, the federal government, all state governments around the state, all state and territory governments are trying to get an increase in the contribution on the activity-based issues from the federal government. But at the moment, the federal government is refusing to do that. Now, we're all hoping that there will be an increase. We're also looking at issues like they work out how much they give us each year based on figures that are now 3 years out of date, and there's been a big increase in costs. So all of those issues have to be taken into account. Just picking on one thing and saying, this is a document from Health, well, I haven't recognised it. I don't know where it's come from, and nor does the Secretary. So to try and put propositions of a document that can't be identified is really, it's outside the scope of normal practice.
Minister, thank you. I'll put questions on notice in relation to this because I've only got a couple of minutes left now. I did want to turn to another issue, which is the Australian Bureau of Statistics latest deaths data published on Wednesday last week shows that in 2021, it's basically about the alcohol-induced deaths that are the highest rate that they have been in 10 years. Extremely concerning. I did kind of want to ask about this, but from a policy perspective to you, Minister, the level of advertising of the alcohol industry during COVID was sickening, actually, sickening. I remember doing all the walks in lockdown, walking around, it seemed like every single poster and billboard was advertising alcohol. Is there anything that your government is doing, firstly, to reduce alcohol advertising further in New South Wales? Is there anything that you have taken? Is it a concern to you? Because that is a big factor, I think, in what is happening here is the amount of alcohol. It is just, there was a blitz during COVID and people are clearly, suffering, and there is that 10-year high. So firstly to you and then Dr. Chan about what the New South Wales Health is doing about this.
Obviously, governments around the country are very aware of this, and again, it's been for discussions, and we're all looking at what measures actually work in regard to a reduction of alcohol consumption, particularly amongst young people, but I'm going to pass that to Dr. Chan.
So thank you, Ms. Furman. I read that report with interest, and we are obviously looking at those reports. I think what's important to clarify in that report is that those deaths were related to predominantly chronic alcoholism.
Yes, they were.
And it does reflect the burden of disease that alcohol attributes to our society. From a population health programs area, we continue to, and drug and alcohol in my portfolio area, we continue to provide education and support for people to manage, to decrease alcohol intake at a population level, and also are working with those that have alcohol as a perceived problem, often as in conjunction with other drug and alcohol issues. So I do accept that alcohol is a major public health issue and does require a coordinated response, but we are working as part of important risk factors that require to be addressed.
Well, that brings us to the conclusion. We've made it by 6 minutes, Minister, which is good to enable you to get away to your commitment at 4:30. So thanks very much, everyone, for coming along today. There have been some questions, I believe, taken on notice, and I expect there'll be some supplementary questions. So the Committee Secretariat, in the usual way, will liaise in regards to those. Thank you.
Thank you.
Thank you.